We are now on our next episode of CME, organized by National Institute of Homeopathy Alumni Association. And we are having with us our co-host, Dr. Debnaran Kalyani sir, our president of Alumni Association.
Kalyani sir, please take over. Hello, Kalyani sir, please take over.
Uh, Very good evening to everybody. We are going to start a excellent CME today, 13 CME, and we are really lucky that today we got three pillars of homeopathy. One is ex-director of National Institute of Homeopathy. Several times he took the charge, Dr. S.K. Bhattacharya. Present director, Professor Dr. Subash Singh, and Principal Dr. L.K. Nanda and Dr. B. Dhanalakshmi. We welcome everybody on behalf of Alumni Association and expecting a very nice seminar in presence of these pillars. This is the seminar. The purpose of the seminar is just to not only just to have an interrelation with the alumni, but to provide our experiences, share our experiences, and increase our confidence and contribution to the system. So we think we'll be much benefited in this CME with the help and blessings of present director and ex-director. Thank you very much. Let us start the CME. May I request our director, present director, Dr. Subash Singh, to welcome our guest speakers and to bless us and to encourage us for this CME.
Thank you very much, Dr. Kalyani sir. I hope I am audible. Uh,
Yes, sir,
it
you
is
are
an
audible,
honor
sir.
to. Thank you. It is an honor to be in the same platform with so many dignitaries of NIH who were associated with NIH and who made the NIH what it is today. My respect to Dr. S.K. Bhattacharya, Samir Kumar Bhattacharya, who has been a beacon light for NIH, being a being an alumni of NIH, the first batch of DIP NIH, and then took administrative post and shapelined the NIH. We were lucky to work under him. In fact, if you ask me personally, then I joined during his tenure only. I welcome you, Dr. Bhattacharya, sir. I'm sure your presence here will mean a lot to all the persons who are listening to it. I'm informed that Dr. L.K. Nanda is supposed to join. L.K. Nanda is a very well-known name in homeopathic academics. He has been associated with Abhin Chandra Homeopathic College as well as with Central Council of Homeopathy in different capacity and with CCRH. He has also been the first batch Deep NIH alumni of NIH. So I welcome him. I hope his enlightenment on osteoarthritis, which is a big problem, and his snapshot prescription keys will help all of the listeners a lot in their prescription. And my very special welcome to Dr. Dhanalakshmi, who has been fighting alone in Pondicherry and putting up the flag of homeopathy as well as through her works, keeping up the name of NIH. Dr. Dhanalakshmi, it is a pleasure to welcome you, and I'm sure Your work on Bogers will enlighten us all. We all know that, like Kent, Boger is one of the few persons who has worked on all the three main spheres of homeopathy. He has his work on repertory, he has his work on the philosophy, and he has his work in Mathematica. And all these three works are marvelous. So we look forward to listening to you, Dr. Dhanalakshmi, and learning from you about Dr. Boger's contribution to homeopathy. With these words, I once more welcome you all and thank the organizers for organizing and keeping up this organization and regularly organizing this CME, and especially bringing all the big stalwarts, learned people together on this platform, which will be a great boost for all who are presently associated in any capacity, whether they are faculty or doctors or PGTs or students or those who have passed out. So I welcome you all, and I was only hoping that I can all welcome you all physically to NIH. But the COVID situation is such that it do not allow me to welcome you. However, we try to keep you abreast about the various activities of NIH that is happening. We have been fighting COVID as the front warriors. We have done different research works. We have given arsenic medicine through different camps to more than 15,000 family doses we have distributed. We are maintaining the record, and we are very hopeful. The record that is showing, the statistics that it is showing is wonderful. We are also working. We had sent a team to Chennai, where they were working with ESI and Chennai government to give homeopathic medicine on the COVID positive patient. We are looking forward to get a very positive and encouraging result from them. We also have sent a team to Dharavi, Mumbai, and we are looking forward to their result also. We hope that within 1 month, we will all getting the results, and we will be publishing it very soon. That will make all who are associated with NIH, it will make all of us very proud. On 10th Foundation Day, this year we cannot organize a physical program as we usually do, and every year we do. But we are doing a program on virtual platform. So it is being publicized and links are being sent. For that, you need to register. We are having a galaxy of speakers and a wonderful program. So I'll take this opportunity to request all of you to be associated with that program so that you can learn, you can listen, and you can know what are the activities that is happening. There are various, in fact, NIH is one of the very few organizations all over India which has not been closed even for 1 day during this COVID pandemic. All the faculties has been taking classes, all the staff has been coming regularly, and that is a big thing for NIH. The works on deemed university is progressing, and we are hopeful that we will be able to give you some good news very soon. And there are other activities also being going on. So this is all about the NIH, and we hope very soon we will give you more good news. So before I conclude, once more, thank you all and welcome you all for this CME. And I hope this will be a very meaningful interaction. Thank you so much. Thank you.
Thank you so much, Subash sir, for your blessings and your encouraging words for our CME. And with permission of Kalyani sir, I'll request the backstage editor to please bring up Professor Samir Kumar Bhattacharya, today's moderator, to start the CME. And first speaker will be Professor Nanda. Orko, please bring up Professor SKB sir on the screen, virtual screen. Sir, if you can put on your video. Good evening, sir.
Good evening, sir.
Good evening.
All the
Good evening to Dr.
alumnus,
Bidyut, Dr. Devnarayan Kolkata, all everybody present here in the virtual meeting. And we are anxiously waiting to hear Dr. Nanda, and particularly myself, very eager to hear Dhanalakshmi, because they are our future. I want that they should come up very prominently in this platform. Okay, thank you. Let you please start the seminar. And first speaker, Dr. L.K. Nanda, we are ready. We should be ready to hear him with all his, because he is the master of materia medica. And I have seen these, not only Allen's keynote, many materia medica, which we use, which we read, we see during different meetings in CCRH and in different areas, that he has got sound knowledge in materia medica, and he has got a very good practice also. So cervical spondylitis is such a problem in this era that it needs, I am sure that homeopathy is the only system which can give proper treatment to the cervical spondylitis. So everybody, I think, will be benefited by the lectures of Dr. L.K. Nanda. Please start it. Thank you.
ओपन कर देना। Hello. Hello. Am I audible?
Yes, sir, you are audible.
Okay, thank you. Good evening to everybody present in the webinar today. Respected Professor Dr. S.K. Bhattacharya, sir, former Director, National Institute of Homeopathy, Dr. Subash Singh ji, present Director NIH, who has given his introductory speech and the activities now he is taking for NIH in view of COVID-19. We thank him for taking so many good steps to tackle COVID-19. I sincerely request him to carry this program, which will bring good name to homeopathy. And my dear organizers, Dr. Debnara and Kalyani, President of the Alumni Association, Dr. Bidyut Mukherjee, and my co-speaker, Dr. Dhanalakshmi, and other dignitaries, listeners present in the webinar today. So let me start the topic today, and at the outset, I extend my gratefulness and thanks to the organizers to organize such CME regularly with so much difficulty and carrying it and giving me the chance today, opportunity today to interact my experience on cervical spondylosis, a very prevailing disease nowadays. So let me start quickly. They have given me 1 hour time. I will finish it in 1 hour. Start. I am screen share.
Okay, sir. Sir, I think there is a problem with your PowerPoint, sir.
PowerPoint?
Yes, sir. Now it's on.
So my topic is homeopathic approach to cervical spondylosis. What is happening?
I think, sir, PowerPoint is showing some problem, sir.
No problem. It is yesterday I spoke in an webinar. Hmm. Acha.
Sir, please turn on the slideshow again.
Okay, let us see. Yeah, okay. Now it is there.
Okay, sir.
So, cervical spondylosis, as you know, is a chronic degenerative lesion of single or multiple intervertebral disc with osteophytes in related vertebral bodies. That means it is a chronic degenerative disorder and found in the single or multiple intervertebral disc with osteopathic growths in the related vertebral bodies. The global prevalence of cervical spondylosis is 55% in screen using workers. Nowadays, IT workers are using screens for 12 hours. So this is a problem with them since long. 55% of the screen users are suffering from cervical spondylosis. It is a leading cause of musculoskeletal disability in human. One of the 10 top causes linked with disability. It adversely affects the quality of life. And if you see, look to the treatment, only palliative painkillers are the approach in allopathic medicine or conventional medicine. In advanced pathological cases, surgery, that is disectomy, is usual practical with less success. So there is an increasing trend of the society, of the patients suffering from cervical spondylosis towards homeopathy. And as we are all practitioners since long, if you can if you can see, if you can just foresee, if you can see your case records, every 10th patient of a homeopath is an arthritis patient or spondylosis patient. So before going to the treatment approach, let me have a glance over causation, pathology, signs, symptoms in brief, because this knowledge will help us in prescribing. So the coming to the anatomy of intervertebral disc, you see this is the vertebral body, intervertebral disc, and intervertebral disc constitutes of annulus fibrous and nucleus pulposus. This is the main thing which is responsible for the pathology of cervical spondylosis. This is spinal cord. This is the PPT, posterior longitudinal ligament, anterior longitudinal ligament. This is spinal nerve root. These things are all this is the all pathology settle off on this intervertebral disc. So intervertebral disc consists of the cartilage end plate, nucleus pulposus, and annulus fibrosus. See, this is the transverse section of the this vertebral bodies. You just see this the intervertebral disc dissected. In the intervertebral disc, the central is nucleus pulposus. The surrounding rings are annulus fibrosus, and this central nucleus pulposus is a highly hydrated structure containing 88% of water. It consists of proteoglycans, collagen matter, and elastin fibers. And these proteoglycans, they imbibe water and keep it in a pulpy-like substance. And because of it is pulpy and being much hydrated, it has got a tough characteristic of compressibility. This is very important. Intervertebral disc is like nucleus pulpus is like a rubber, and it absorbs all the shock absorbs to the spine. This is annulus fibrosus surrounding the nucleus pulposus. Annulus fibrosus are nothing but collagen fibers, strong collagen fibers surrounding the nucleus pulposus. It keeps nucleus pulposus inside the membrane, inside the annulus fibrosus. If annulus fibrosus rupture, this will come out. So this is a very strong fibrous structure around nucleus pulposus, and this takes main pathological role in the development of cervical spondylosis. See, this annulus fibrosus function is to contain nucleus pulposus and maintain its pressurization under compressive loads. If there is a load come on the intravertebral disc, the load transfer to nucleus pulposus, and nucleus pulposus may come out of the intravertebral disc, but because this annulus fibrosus is a strong fiber around the nucleus pulposus, so it restrict it inside and do not allow the nucleus pulposus even under a compressible load to come out. So the factors responsible for cervical spondylosis is congenital and developmental. Coming to congenital, the main very important cause is repetitive mechanical activities, frequent bending, twisting, lifting, other similar activities without breaks and improper stretching is it causes repetitive mechanical trauma to the spinal cord, spinal vertebrae, intervertebral disc, which resulted in cervical spondylosis. Living a sedentary life is very important. The persons who, doctors, students, scientists, who are living a sedentary life without any exercise, more prone to herniated disc, because the muscles that support the back and neck by prolonged sitting becomes weak, which increases the strain on the spine. If the muscles supporting the vertebrae will become weak, it will give strain to the body's intravertebral disc, strains on the spine and causes a damage. Traumatic injury to lumbar disc, when there is a trauma, road accident, and there is an injury that causes annulus fibrous to rupture, and there occurs cervical spondylosis. Obesity is also a very important cause for cervical spondylosis. Overloading the intervertebral disc, the vertebral body also causes there is cervical spondylosis. Similarly, poor posture, by a poor posture, sitting bent, sitting to left, tilting to left, tilting to right, there is improper spinal alignment. If the vertebral if the improper spinal alignment, it also causes pressure on the nucleus pulposus, rupture of annulus fibrosus, and causes spondylosis. Tobacco abuse, toxins reduce disc ability and absorb the nutrients, so that also causes the spondylosis. Then other environmental factors, laborers taking load on the head regularly, chronic cold, using thick pillow, fast bike riders, typist neck, lateral and forward tilt while typing, air-related changes, degeneration of nuclear, when we are in old age, that there occurs degeneration of the nucleus pulp, and that causes damage and osteopathic formation, leading to cervical spondylosis. Mechanism. Two factors are responsible to cause cervical spondylosis. The first factor is degeneration of nucleus pulposus. Second fibrosis is the injury to the surrounding fiber, annulus fibrosus. The surrounding fibers to the nucleus pulposus, if there is a trauma and there is uneven pressure on the annulus fibrosus from inside by the degenerated nucleus pulposus, it ruptures and causes cervical spondylosis. See, when there is a load on the, suppose you have taking some load on the head, when there is a load on the head, the load transfer to vertebral bodies, and if the load is in the normal nucleus pulposus, when it is a normal condition, in the normal healthy disc, the nucleus distributes the load equally throughout the intervertebral disc. As the disc undergoes degeneration, the nucleus loses some of its cushioning ability and transmits the load unequally to the annulus. You see, this is degenerated, and the load presses the nucleus pulposus, and it protrudes to outside. So, to sum up, between the vertebral bodies lies the intervertebral disc. The discs are like a rubber washers and allow movements of the spinal column. The disc contains jelly-like material surrounded by a fibrous ring. I have told you that is annulus fibrosus. When the annulus fibrous ring becomes diseased due to injury or any other condition, then the jelly-like substance, that is nucleus pulposus, is pushed out and prolapse into the spinal canal and causes pressure on the spinal cord and accompanying nerve roots, causing pain in the neck, and it distributes to hand and other parts of the body. See, this is the biochemical mechanism. There is a decreased proteoglycans contents of the, this is vertebral body, this is intervertebral disc. The normal disc, see the proper shape. When there is a decrease in the proteoglycan content, there is decrease in the hydration, decrease of the water content, so there are caused degeneration. See, there is a degeneration. When there is degeneration, there is a decreased hydrostatic pressure, no water, so decreased hydrostatic pressure, so loss of disc height. See, this is the loss of disc height, and uneven stress. See, this is the loss of disc height, uneven stress. This is the see the disc height here, and this is the disc height. There is a great loss to the disc height. Vertebral space reduces, and lastly you see degeneration. This is all these annulus fibrosus here turns out and giving rise to osteophytic changes. These irregular surfaces are osteophytes. They pressurize on the spinal column. Here you see the one of the disc here, nucleus pulposus comes out, gives pressure on the spinal root, spinal cord here, and there occurs pain. So it will be very easy to understand this pathology. First, degeneration. It is inside completely. When the degeneration, it protrudes out. That is degeneration stage. When it protrudes out, then it is prolapses. This is the spinal intervertebral disc. This has to be like this. But when the degeneration, it prolapses out. And lastly, when this mechanism fails, when the annulus fibrosus unable to retain, that breaks out, and the nucleus pulposus comes out, known as stage of extrusion. And lastly, when comes completely out, going inside the spinal nerve root, going inside the spinal cord, sequestration. So this is first is nucleus degeneration, then is disc protrusion, then is disc extrusion, then sequestration when the nucleus pulp comes out, and lastly the stage of repair where the repair starts after degeneration. The residual nucleus pulposus becomes flattened, fibrosed, and finally undergoes calcification. At the same time, new bone formation occurs at the point where the posterior longitudinal ligament has been stripped off from the vertebral body and spur formation occurs. So this is the pathology. So so this is known as the prolapse disc. We must know that a disc never slips, or slip disc. A disc never slips, thus simply it prolapsed outside. There is no slip disc. So to summarize again, this is a vertebral body, normal intervertebral disc. There is degeneration here, you see. After degeneration, there is bulging of the disc. Then there is the disc, herniated disc. It comes out, see, and then now it already degenerated. The space is very narrow. That they squeeze each other. There is a thinning of the disc, and lastly here the posterior longitudinal ligament stripped out from the surface and causes fibrosis and calcification, giving to osteophytes, and these osteophytes presses the spinal cord, spinal nerve root, and causes pain. Why it is hanging? Very sorry, why it is frequently disturbing.
Okay, sir. No problem. We are waiting, sir.
Any problem with the screen sharing? Organizers, any
no, sir.
problem with the screen
No, sir.
sharing?
No, sir. Not with that, because your cursor is moving, so there is no problem with screen sharing. But I think there is a problem with the PPT itself. Because your screen is completely showing everything. Yes, sir. It's problem. There is a problem with the PPT, sir. Because the message which popped up, that says everything, sir.
Very sorry.
It's okay, sir. No problem. To all viewers, please just wait for a few minutes until sir comes up. Okay, sir. You can continue now. Sir, your microphone is showing some problems, sir. Hello, sir. Can you hear me, sir? Yeah. Hello, sir. Can you hear me, sir? Please hold on until we get connected with sir. Audience, please wait. We are trying to connect with sir. As soon as we get connected, we will show you and we will continue. Until then, please wait. Don't go anywhere else. And until then, let me just take the time and say you can now get e-participation certificate, which is auto-generated from the link given in the description. All you have to do, just fill up the details asked over there and fill up the question, means answer the questions, and you will get an auto-generated e-certificate. And if you didn't get on time, then do make sure to email us your problem on nihalumnimeet@gmail.com. Over there, I will be present to handle the main thing, and the other IT department will be present to handle your problem. So with this, please wait until we are very much trying to connect, sir. Hello, Kalyani sir.
Yes.
Can you please take over for now, because we are unable to connect sir, and but we are trying our best to get connect with sir. Please take over for now.
Best thing, we can utilize the time by requesting Dr. Bhattacharya to provide his experiences on joint or bone diseases. That will be greatly help for us. Sir, Orko, can you bring, sir? Sir, due to constraints,
Yes,
we
I
are.
understand. I
If you
understand.
kindly please provide us some experiences.
But one thing I am telling you, Dr. Nanda is the main speaker. And we can wait for some times, because if I
Okay.
tell something which may hamper his speaking,
Okay.
so let
We'll
him
be waiting.
complete. Then we will discuss. We have got enough time. We can wait.
Okay, sir. No
It will
problem.
be better. Please don't mind.
No, sir, nothing to mind. Okay, sir.
I think sir is still now continuing, so he is unable to hear us and also get connected, because I don't know, sir is not receiving our call, but we are trying our level best to get connected. Kalyani sir, if you want to say anything or something, you can continue, sir.
See, just to utilize the time, I can share my experiences on spondylosis. I had the privilege to work on this disease in National Institute of Homoeopathy in Research Department, OPD and IPD. So, what is my experience I can share? Which you are listening from Dr. Nanda is a very nice thing in every details of its physiology, anatomy and pathology. But what we have found in our OPD, in brief, I can tell you that the complaints, radiological deformities found in the reports, that can be completely cured radiologically by homeopathic medicines. That is our experiences in OPD and NIH. Few are published in NIH bulletin, few are yet to be published. Degenerative joint disease, even osteophytes, bony growths can be regressed. Then your complaints, clinical complaints, definitely it will be over within few weeks to few months, never takes more than few months. Radiological improvement, we have seen it starts after 3 to 4 months, and we have seen maximum period taken is 37 months, minimum is 16 months to completely obliterate osteophytes in cervical spondylosis. Degenerative joint disease, as we are learning from Dr. Nanda, that is physiological alteration in disc, reduction of density, reduction of viscosity, prolapsing tendency. This can be cured within few months, never takes more than 1 year. And symptoms, it goes within few days to few weeks, because the pathology what we have learned till now, it is practically ligament and muscle disease. That means due to disuse, unused or overuse. These are the three factors for any bony or joint disease. So these factors are directly involved with muscle contraction, muscle flexibility, muscle activities. Because of these muscle activities are altered intentionally, or your socioeconomical factors, or your working habits, illiterate, ignorance. Practically, we do not know how to use our neck, especially which we are learning from Dr. Nanda, that we, the table workers, throughout our life, we are concentrating on tables, on books and papers, but we do not know that certain specific angle, certain distance from the subject to the eye, it is very much essential. If anybody practices this writing or reading less than 1.5 feet from the eye to the subject, bending head forward, keeping the item means reading or writing item nearer to the chest, means bending the heads. If somebody was go on working in this manner, or carrying weight in hands or head for a long period without proper nutrition and exercise, these are the basic factors, especially for the table workers. We people like doctors, gradually the muscles become fatigued. Primarily it gives some strain, pain factors we usually ignore by giving warm compression or some other things, etc. By external application we ignore. Gradually this warning is overruled by our ignorance, and ultimately muscles become fatigued, weak. They cannot hold the vertebrae in proper posture, proper direction. You know that all the spines, cervical, lumbar and thoracic, have got a curvature, specific curvature. The normal lordosis is lost. Spine, cervical spine is supposed to be in this manner, never straight. So if you go on doing whatever you like, or putting the heads whatever you like, gradually this normal axis of the cervical spine, it becomes straightened. Means compression in one side, gradually it's higher. So what we have experienced, that the very simple medicines in homeopathy, which has a tremendous control or efficacy on muscles and ligaments, gives an immense help to palliate. I can tell you few common drugs most of you uses. Simple rastox, bryonia, hypericum. If you go on using these drugs, within a very short period, very short period, the pain can be controlled. Say for example, if you find the modality of rastox with excessive thirst, getting aggravation in first movement and getting relief by continuous movement, excessive thirst, and if we get red triangular tip, take it for granted rastox will give him palliation 100%. If we find aggravations not in the early morning, more exertion activities goes on, there is pain, difficulties, it gets released by pressure, massage or warm application. If we are fortunate to give constipation and dry tongue with profuse thirst, take it for granted 100% cases the pain of the cervical spine or spondylitis is going to be relieved. I am not telling of cure. If we find the complaints of the patient is much more than the pathology by getting the x-rays, there is slight change, minimum change, early spondylosis, but patient is shouting like anything, disturbing us like anything. Sir, I cannot bear my pain. I am not able to move my head. That means sensitivity of the nerves is much more than the pathology. Take it for granted hypericum is going to palliate. Means within a very short time, we are able to convince the patient that homeopathy can give relief. Now regarding cure, what we have seen, the same theory since Hahnemann we have experienced, we are confident from OPD of NIH that constitutional drugs can definitely cure these bony changes. Completely it can make the cartilages normal, vertebrae in normal alliances. I have few hundreds of cases, means presentable, documented, cured cases of different types of pathology, of cases of IPD and OPD that constitutional drugs is able to cure. Intentionally, I tried with 176 cases. About 390 cases we tried with constitutional drugs, and intentionally, including placebo effects. Few cases, about 2000, 170, I cannot exactly remember the number, about 2000 cases I tried with simply palliative drugs, hypericum, rastox, bryonia. What you have find, or any other common drugs, short acting drugs or deep acting drugs, they are giving relief definitely. Sometimes patients are becoming complaintless, but radiological changes are not being improved. I didn't find a single case of this short prescription or palliative drugs which was able to completely cure the radiological changes. But it is encouraging. By giving constitutional drugs, we have seen 60 to 70% of cases who are not grossly changed completely can be cured by constitutional drugs. We also tried with simply only constitutional drug without giving any palliatives. There also we found patient is facing difficulties for a long period because constitutional drugs are not always able to palliate immediately. If patients are convinced, and we are fortunate that patients of OPD NIs are being convinced by the setup of the OPDs and doctors and staff relations. So we are fortunate that we could try few patients without giving any palliative drugs, and we found it is taking to relief for a long period, but ultimately improvement starts. Improvement is slow but steady. By this time, many other accessory complaints other than spondylitis is getting cured or relieved, and ultimately patient is showing gradually radiological changes. We are having the reports before, during and after treatment. We have experienced that single constitutional drug or what you called as symptom totality, individualistic approach can 100% cure the bony changes if patients are allowed to be treated. That means why I am telling these things. We have seen many patients, most of our patients are financially poor. Once they get relief, once they are improved, once they're able to do their activities normally, they do not turn back to OPD. They think that they have been cured. We have seen those cases are relieved but not cured. Radiological changes are still there. So what we say to the patient, sorry, after getting relief, don't be satisfied. Until radiological report comes normal, you stick to the treatment. You need to come in a very long gap, but do not discontinue. Then the things will again come back. By telling these things and by seeing the reports, many patients are convinced. They allowed us to treat for a long period without any complaint, and ultimately we are able to show the patient that your radiological changes has been also cured. By this time, another achievements patients usually experience, we are also happy that during the treatment of the spondylosis, many other accessory complaints completely vanished. Patient gets a general toning up effect, good sleep, good appetite, fine fresh feeling, as if the patient has got a new life, cheered up life by the constitutional medicine, which is never possible by palliative treatments. So friends, when we are insisted to relieve immediately, we may have to think for the palliative, but never be satisfied by the palliative drugs. Then ultimately your name, fame, and the name, fame of the homeopathy is not going to be raised up. You must agree with me that homeopathy is never surviving for palliation, never surviving for giving relief, but it is surviving in the world by fighting various constraints till date since Hahnemann, only for the reason homeopathy can permanently cure many pathological situations. And you must agree that bone is such a tissue, next than teeth, heart tissue, pathological changes, it takes time to grow. Equally, it is supposed to take a lengthy time to completely improve. Means if you want to see radiological improvement or radiological cure, you have to wait. You have to mobilize patient by convincing that though there is no complaint, you should not discontinue. One more thing I can tell you, that for spondylitis, almost we have been habituated with exercise, physical exercises. We had a group of patients, intentionally we secluded to see whether treatment of spondylitis, sorry, treatment of spondylitis, either cervical or lumbar, both we had the records, whether physical medicine is essential or not. Can homeopathy overrule the physical medicine by exercise, physiotherapy, hot application, traction, thrust. And you will be astonished to know number of cases, not 1, 2, 3, few hundreds of cases we tried. And we have seen exercise in homeopathic treatment is not a must, which is a must for other modern system or other conventional system. What I want to tell you, that if our drugs are correct, if we can select the right drug for the right patient, take it for granted, all other mechanism automatically toned up. Muscle gets toned up to drag the vertebrae in normal posture. Ligaments do their normal physiological activity to keep the cervical vertebrae in normal arrange and to maintain the curvature, physiological curvature. This is astonishing. So, physical medicine, homeopathy in homeopathy treatment is not a must. Homeopathy is this much capable, record says. But it is advised to give quick relief. Physical medicine is good along with homeopathic medicines. As we give diets, high calcium diet, vitamin C to supplement calcium supply to the affected areas. As you know, the elderly ages people are become weak due to deficiency and inactivity or weak activity of parathormones liberating from parathyroid to maintain the calcium balance. So that time from external sources, calcium and vitamin C become essential. As we do that, as you ask the patient to take some milk or milk product and vitamin C, either lemon or any vitamin, amlas or anything, accordingly, if you advise the patient to have exercise physiotherapy, that will shorten the suffering. It will make quicker recovery. But it is not a must for homeopathy that we have experienced. So, dear friends and respected seniors, we will be waiting for some time for Dr. Nanda. And I want to add few words of Dr. Nanda. He is such a brilliant student. Fortunately, it is ready, Dr. Nanda. Have you got him, Bidyut?
We are trying to contact. We had tried to contact Dr. L.K. Nanda sir, and he had received the WhatsApp messages, no response. Probably there might have been some network issues. Dr. Ompriya on the backstage is also in touch, sir.
You are not audible properly.
I'll request Professor SKB sir to being the moderator.
Dr. Bidyut Mukherjee and Dr. Kalyani, I think we should invite Dr. Dhanalakshmi to complete our speech. And because when Dr. Nanda will be ready, after Dhanalakshmi, he will deliver his speech. I think it will be better.
Exactly, definitely.
So please invite Dr. Dhanalakshmi to complete her speech. We are very eagerly waiting for her also.
Please, Dr. Dhanalakshmi. Good evening.
Good evening, sir. Good evening, respected Director, sir, Dr. Subash Singh, sir, and Dr. S.K. Bhattacharya, sir, our President of Alumni Association, D.N. Kalyani, sir, Bidyut, Pralayda, whom I call Dada only, of course. Pralayda is our Medical Superintendent of National Institute of Homeopathy. My respected seniors, my dear friends, yes.
Sorry to interrupt.
Yes, Dada.
Now, just now, Dr. Nanda had rejoined it.
Okay.
Then how it happened, sir? I am going on talking. Just a minute. I'll conclude. Just a minute.
Thank you. It's a pleasure.
I'm just concluding.
Welcome back, sir.
Okay. So since how much time I am out of scene? 5 minutes.
About.
No, sir. Almost half an hour.
Bit more than
half an hour I have out. I am not able to listen.
Yeah.
Half an hour.
Yeah. There were some network issues.
Lali,
From
I
the
am
place
going
of
and talking.
intravertical.
I am going and talking since long. Not audible, na?
Not audible. We were
Yes,
audible
sir.
up to
There
the
were
level like
certain issues with
pathological
the
changes
network.
of disc
You are
prolapse.
audible up to which extent, sir?
Disc prolapse.
Oh God, I am honestly talking. Disc
Oh,
prolapse only.
sorry,
That
sir.
one.
Disc how it prolapse and what happens? Compression on
Oh
spinal
God.
cord.
And this research methodology, everything is not audible. I am simply
No,
going and
no, sir.
talking.
Sorry,
Oh
sir.
God, what happened? Huh? So just so just I'm showing me. So just I'm showing beginning. Bye.
Okay, sir.
So this is disc prolapse means in very beginning, sir. Na? Am I audible now, sir?
Yes, sir,
Hello.
you are audible.
Okay. So I'm straight coming to homeopathic chapter. There is several describing methods for cervical spondylosis. These are personality prescribing, prescribing on totality, prescribing on keynote, lesional prescribing, nojodes, and zigzag way. So many when there is a clean cut mental and physical general, we took off totality symptom and prescribe on the basis of it. When there is a good personality symptom of the patient, that we prescribe on mental trait or personality, that is the prescription is personality prescribing. And when there is no clear cut totality, no clear cut personality prescribing, then we depend on keynote, and in very advanced cases we depend on organo specific drugs. When there is an absence of so I have make a study to compare which method is good, which method is more effective, and for that I have taken two methods. One is first group is prescription depending on constitutional medicine. Second group is prescription depending upon keynote. When there is a paucity of mental symptom, paucity of general symptom, I depend my prescription keynote, and I just compare the two groups, which group is more effective. Okay, so study design, I have taken two groups, each group contains 30 patients, and selection criteria to the first group where there is a mental general, physical general is very clear, depending upon the aphorism 5, 147, 211, 212, who advocated the prescription on individualization. I based my prescription on individualization. Second group where there is absence of mental general, physical general, in advanced cases, only characteristic symptoms are visible. I prescribe on keynote. I just compare statistically which method is better, and you see this. I have used statistical analysis was done using statistical package for social science SPSS version 20, and both the methods are evaluated on a paired t-test to evaluate which method is more effective. So this is the p-value. Have a look. I will not take much time because unnecessarily half an hour I have talked. Then from this comparison of the p-value, it is observed that prescription based on totality is more effective than keynote. When the prescription based on totality, that is 70% effect, whereas prescription based on keynote, there is 30% effectiveness is there. And the drugs is a fast drug I see, Noxvomica. I prescribed to 11 patients, 9 cured. Rostox, I prescribed 10 patients, 7 cured. I prescribed natrium. So these are the drugs in order indicated in my study, and see the result here. How much persons prescribed, how much cured. So likewise, see the list of drugs like this. Similarly, keynote drugs are prescription keynote. The drugs are calciraflor, Paris quadrifolia, radium brom, chinnum sulf, lacnantis, X-ray, strychnine, indium, juglan cinerea, chinopodium glauciaphis, anosmodium, chinopodium antihelmeticum, ranunculus bulbosus, oleum animali. Like these are the drugs prescription based on keynote. Frequently, the rubrics I consulted from the repertory, she have a look, no time to go in detail. These are the rubrics I frequently use. This is a very important rubric. Pain in cervical lesion, aggravation sitting, Nox vomica ruta. So likewise, these rubrics, important rubrics, see pain in the neck extending to both the arms. Both the arms are brownia, chelidonium, natromure, Nox vomica. Pain in neck extending to left arm, calmia, lachesis, perisquad. Pain in neck extending to arm and fingers. There is lachesis, Nox vomica, perisquadrifolia. Pain in, so likewise, pain in neck extending to clavicle, extending to shoulder, extending to right shoulder, extending to left shoulder, so like a lot of rubrics are there in the repertory, which one should be acquainted to prescribe for spondylosis cases. So in you see, when there is a pain in the neck extending to both the arms, drugs are Nox vomica, natromure, chelidonium, brownia. See, Nox vomica is the first drug which helps me in my prescription. So, because Nox vomica, pain in neck is aggravation by sitting, and I have told you that possession of cervical spondylosis is sedentary habits. Sedentary habits possess a personality psychological stress on the person, and psychological stress causes degeneration of the nucleus pulposus and resulted in cervical spondylosis. So Nox vomica is a very, very helpful drug, and the symptoms are pain in the neck extending to arm and fingers like brownia, chelidonium, natromure, pain in neck extending to left arm, lachesis, perisquad, calmia, and I have made symptoms like common symptom and determinative symptom. Nox vomica common symptom is pain, neck, aggravation, sitting, and Nox vomica determinative symptom is pain accompanied with tingling and aching. And when the person suffering from cervical spondylosis due to long continued mental exertion, sedentary habits, Nox vomica is the drug. And as you know, these are all peculiar mental symptoms: quarrelsome, jealous, perspiration on upper lip, short sleep, amyloids, sleeplessness, 3 to 5 m. These are all the symptoms of Nox vomica, basic and determinative symptom to prescribe Nox vomica. Similarly, natromure is also the second drug comes in my study, which helps more to cervical spondylosis patient. And here, the pain in neck is aggravation by talking, writing, reading, and lying down. Okay, and the determined symptom, as you know, desire salt, heat option aggravates, awkward, hasty, drops, think from nervous weakness. These are all symptoms of natromure. Similarly, chelidonium, you know, very good drug for cervical spondylosis, the right side remedy, and when the pain is more in morning, pain in neck more in morning, and extending to both the hands and affecting right scapula, chelidonium is the drug of choice. And chelidonium is pain is accompanied with coldness of limbs. Brownia, a good drug for cervical spondylosis, because as you know, slightest movement causes pain in brownia. So this is the important, this is a common symptom. But to prescribe brownia, we must remember the peculiar mental symptom. Brownia like calciraflor, apprehension, fear of poverty. There is a busy industry, he's a busy person, industrious person, talks of business. Because of the talks of very interested in business, there is exertion, both mental, physical, and suffers. Brownia patient desires soup and warm milk. Similarly, you see here, pain in the neck extending to left arm, lachesis, perisquad, calmia, rhodium, hydrogen. Pain in the neck extending to right arm, solanum lycopersicum ferrumpic. Just to touch the drugs, we know lachesis, left-sided drug, so pain extend to left arm. But the important symptom is lachesis is a hot patient, loquacious, witty, sarcastic, excited, jealous, competitive, aggressive sexuality, menopausal. This is the very important points to prescribe lachesis for cervical spondylosis, and along with there is a pain in the neck extending to left hand. Paris quadrifolia, very important keynote prescribing drug for cervical spondylosis. As you know, PQ for heart. Similarly, PQ is a very important drug for cervical spondylosis. Symptoms when the pain is extending to left arm and also extends to chest region, intercostal region. At times, cervical spondylosis patient complains of there is a heart problem, but on examination, heart is all right because of the cervical nerve root compressed, there is pain in the chest region, simulating with the heart action. So this is the Paris quadrifolia when the pain extends to left arm and intercostal region. To confirm the symptoms, Paris quad like lachesis, garrulous, silly conduct, inclination to treat others with rudeness and contempt. Okay, so this is Paris quad. Next is Kalmia, very important drug on basing on keynote. Here the pain also extends to left arm along with tingling numbness of the fingers. This is important, and remember Kalmia pain is aggravation by open air, whereas Paris quad pain is aggravation, ambulation by open air. This is the striking difference in both the drugs. In Paris quad Kalmia, pain extends to left arm, but in Paris quad, better by open air. In Kalmia, aggravation by open air. Sometimes spondylosis patient comes to us complaining of, sir, there is neck pain, but there is also accompanying with the vertigo. So when there is a neck pain or cervical spondylosis with vertigo, Kalmia, Chinnum sulf, Eupatorium perf which we given. Chinnum sulf, all of us, you know, there is a sensitiveness of the cervical vertebra, 7 number. Eupatorium purpureum also we know that there is this drug, there is a vertigo, and this is a drug for diabetes insipidus, propionation, and there is a homesickness like Acerifos ignatia capsicum. When there is cervical spondylosis with vertigo, drugs are Kalmia, Chinnum sulf, and Eupatorium purpureum. Similarly, pain in neck extends left arm. Rhodium is a drug. See, rhodium is like lycopodium. Complaints aggravates from 4 to 7 p.m. But intolerance to sweet, lycopodium is very grave, very irritable. But in case of rhodium, though the timing of the pain is same, but rhodium is unusual hilarity and gladness during the day. So pain in the neck extends to right arm, solanum lycopersicum. This is a tomato, prepared from tomato. So when, remember, there is a pain in the neck extending to right arm along with a dust allergy, the like pothos fetida, which causes asthma when exposed to dust. But when there is a sneezing, incessant sneezing exposed to dust, this is the solanum lycopersicum, very good drug for dust allergy causing sneezing. So when there is a pain in the neck radiating to right arm and there is accompanied with the dust allergy and cannot keep mind fixed at work, irritable to noisy atmosphere like pyramid, Theridian, Noxvomica, very irritable to sounds, to noise. This is tomato, that is solanum lycopersicum is a good drug, and the very important point when the pain radiates to right arm. Similarly, ferrumpic, as you know, ferrumpic is a good drug for old persons. Degeneration starts in the body and the complaint started like BSP, locomotor ataxia, etc. So when the pain extends to right hand in case of old persons suffering from degeneration, suffering from BSP, suffering from locomotor ataxia, think of ferrumpic. Similarly, see a number of drugs. Medroinum is a good drug for cervical spondylosis. Rostux, as we know, very good drug, but to prescribe Rostux, very often we prescribe Rostux, aggravation and fast motion, but there is a failure. So to prescribe Rostux, remember one good point that Rostux patient mentally superstitious. Because an example, sir, if I take sour food, it causes joint pain. It never causes joint pain, sour food. But superstitious nature, so Rostux, to think of Rostux, think of the patients must have a superstitious nature. They are believing in the some god's ground. So when these are sweet, these are cold milk, superstitious, fast motion aggravation, Rostux is the drug. Simicipiza, we all know, drug for typists, drug for piano players, drug for computer workers, but to prescribe determined symptom, the person must be depressive in mind with his spiritiness and gloominess, delicate, sensitive, nervous, chilly, changeable symptoms. Simicipiza. And remember, Simicipiza complaints aggravates in the morning and during cold. Very important response. Sir, am I audible, sir? Hello? 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 Audible, sir. Chalo. So then calcarea floor, as Nas said, when Rostux fails, calcarea floor is indicated. So very dependable drug for cervical spondylosis. When Rostux indicated but fails, but determinative symptom to prescribe calcarea for fear of poverty, thinks of money, doing hard work to earn money, a self-dependent person, try to be financially strong by his industriousness and hardworking. Because of this very much greedy towards money, delusion that he is poor. So unless there is a fear of poverty, there is anxiety towards poverty, calcarea floor cannot be thought of like a keynote symptom. Calcarea carb, very much helpful to us when Rostux fails. As you know, calcarea carb is the complementary to belladonna and Rostux. So when Rostux indicated but fails, think of calcarea carb, a very, very helpful drug to me in my practice. Calcarea carb helped me immensely for cervical spondylosis in my practice. The only symptom when Rostux fails but indicated. And along with these 2-3 points I asked, calcarea carb has got the fear of cruelty, fear of roughness of world, insecure feeling always, fear of ghosts, fear of drugs, fear of horrible TV scenes, which affects us greatly. Similarly, tarantula, remember, this is a very, very helpful drug for cervical spondylosis, not exactly cervical spondylosis. We are knowing that neurofibroma often occurs in the cervical region, and when the neurofibroma occurs in between two cervical vertebrae, there is intense pain. Persons are coming to me, operated neurofibroma several times in between cervical vertebra, recurring again and again. If you go to repertory, the only drug tumor in spine is Tarantula hispanica, only drug, only single drug in the rubric. So I have prescribed number of cases. We know that Tarantula hispanica is a life-saving drug, is the euthanasia. So when Tarantula hispanica is prescribed for agonizing pain in the cervical region because of a tumor, because of a neurofibroma in between vertebral bodies, this is the very good drug. And as you know, mischievous, cunning, hurry, impulsive, desire for music, desire for color, always wants to do colors, interested in blue, green, red colors. Syphilinum, we all know, night aggravation and washing mania, this is a common drug we all know, and this is very helpful when the pain occurs only at night. Lactantis, very acute drug. Patient comes to me in the morning, sir, एकदम stiff neck. I cannot move my neck. Psychotic compound. This is a dependable drug. This is a bowel nosure. We know that when plant kingdom drug fails, mineral kingdom drug fails, think of nosures. When nosure fails, think of bowel nosure, and psychotic compound is a bowel nosure. And you see the drug when Rostux, Ferromet, Calcutta, Thuja, all drugs are indicated in one patient. What to give? Combination? No. All the symptoms are in psychotic compound. So when Rostux indicated, Ferromet indicated, Calcutta indicated, Thuja indicated in one patient, think of psychotic compound, and psychotic compound is chilly patient, aggravation by fast motion, rest, night, cold weather, better by heat. Determined symptom when multiple drugs indicated and the psychotic patient is very tense, restless and fearful. Bacillus 7, my dear friends, remember you can safely prescribe this drug for stiff neck, cracks in the neck region, moving the neck, there's a cracking sound, Bacillus nosemben, the only drug in homeopathy for ankylosing spondylosis, where there's a very stiff neck, unable to move the neck. I have a very fine practice. It's a good drug when all drugs fails in cervical spondylosis and the person having a stiff neck like ankylosis. Very there, I am not taking much time. Just I skip over. Pain in the neck, looking off. Graphite is very helpful. Pain in neck. I have just worked out what is the basic symptom of graphite determinative. No time. I'm just skipping over. Pain in neck, looking off. Formica rufa, a dependable drug. Formica rufa. Pain in neck, looking down. Radium brom. Pain in neck, looking down. Caliphus. Determinative basic. Very nicely I have worked out. Pain in, I have told you, I have shown you that when nerve roots are affected, the cervical spondylosis may occur in deltoid, may occur in scapula. So when there is a pain in left deltoid, nux muscata, right deltoid, lycopersicum esculatus, Psilocybus carulox, right scapula, right scapula, Chenopodium and Telmeticum, Juglans cinerea, Oleum animalis, left scapula, Chenopodium glauci. These are all very good drugs. Sphere, depending upon sphere fraction. In advanced cases, when there is no totality available, these are dependable on keynotes. So the indication of pain is left shoulder, guacum, indium asparagus, right shoulder, lycopodium caliphus. So pain neck extends to left shoulder, pain extends to elbow. Pain neck extends to wrist. So see, pain neck extends to fingers. So see homeopathic medicines, how we are being enriched with good medicines. Wherever there is pain, if there is a acute onset, acute origin, totality available, prescribe on totality. If there is a good personal like Nux vomica, patient is sedentary habits, irritable patient, doing computer work day and night, Nux vomica personality, no timings in food, no timings in sleep, and there is a personality Nux vomica immensely help. So when there is, so we can depend on personality, we can depend on totality. When there is good mental symptom, good physical general symptom, we can prescribe totality. When there is no a patient coming to us, no personality symptom, no totality, physical general, mental general, depend on keynote. And when in very advanced cases, nothing, sir, I have got serious pain, my left shoulder, Chenopodium glauciapis, Legionella prescription. When there is a past family stuff, syphilis, family stuff, asthma, bedroinum. So likewise, see, homeopathy is full of with a lot of drugs. We can prescribe on many angles. So to conclude, constitutional prescribing based on totality is very effective for cervical spondylosis. Remember, again repeating, constitutional prescribing based on totality is very effective for cervical spondylosis. Personality prescribing also very important. You see, there is an article come in IGRH that they compared personality prescribing with totality. and they found that prescription based on totality is better than personal prescribing, better than depending on the personality or mental trait. So, keynote also helpful only in 30% cases, not all. Organospecific, I want to caution my dear younger friends, students, PG students. These are very alluring. The organospecific medicines in cervical spondylosis, because of prolonged computer work, we prescribe Simisifuga, so organ-specific. The right scapula, chinopodium, left scapula, chinopodium glauciapis. But remember, patients nowadays we are getting spondine, we are getting lot of patents. But remember, my dear friends, these are the combinations of organospecific drugs, and they have no effect. Simply palliation. Don't be tempted towards palliative patent medicines. It will spoil your practice. Intercurrent are very important when there's a past history, family history. Depending on those, think of nodules, bowel nodules, which are helpful to clear the blockage. So for advanced stages like cord compression, it requires a course of treatment, zigzag treatment. So with the understanding of Kane's 12 observation, second prescription, and with a knowledge of intercurrent medicine, complementary medicine, miasmatic approach, you can definitely approach to all the cases of cervical spondylosis. So to conclude, when the prescription based on totality, there is a 70% cure. When there is a personality prescription based on personality study, I have not done it, but there are articles. Totality symptom basing is much more effective than prescription based on personality trait. Keynote prescription effective in 30% only, but when keynote confers to general symptom, it helps in 70% cases. Regional, that is prescription basing on sphere of action, purely palliation. Don't give it unless advanced case and no other totality is indicated, keynote is indicated. Nodules, intercurrent, miasmatic cleavage is essential. And lastly, conclusion, the findings of the study are consistent medicines are effective for cervical spondylosis. Administration based on keynote is also effective up to 153 in the absence of true totality and general symptom. But administration based on CM, this consistent medicine is more effective than OM. So what Ken told, the idea of sickness in man must be formed from the idea of sickness perceived in a mathematical. That means when a patient comes to us, listen him. What symptom is giving? Is it with a good personality trait? Is it with a good mental, physical general? Nothing, no personality trait, no mental general to base on totality. Go for keynote. No keynote, go for sphere of action. No sphere of action, go for family history, past history, no sorts, and bowel no sorts. And lastly, I'll just show you some auxiliary measures. Sometimes cold packs are helpful, sometimes hot packs are helpful, sometimes electrotherapy is helpful, sometimes ultrasound therapy is helpful, sometimes manual therapy is helpful. Colors, sub-colors, stability and comfort. Sub-colors are given for stability and comfort. Philadelphia color are given not to prevent ambulance. Hard colors for fractures. Cervical traction is indicated in halter traction, machine traction. These are all indicated in advanced cases. Braces, when restriction of movement, the neck braces are given. So I must apologize that in between I go on talking. I have covered up a lot of things in my lecture. Prolapse intervertebral disc, where the nerve roots are coming, where it is nerve roots are going, which muscle affected, everything I have shown. But perhaps it is I am just going on talking, nothing heard by the listeners. However, I took a lot of time. Thanks to the organizers, thanks to my moderator, Dr. S.K. Bhattacharya, and thanks to all of you for giving me a patient listening. And I think that if we'll go in a proper way, in a classical way, we can cure or palliate or give relief to all of our patients suffering from cervical spondylosis. Before concluding, I must say that cervical spondylosis is the domain of homeopath, is the area of homeopath, is the priority area of homeopath.
If you get a cervical spondylosis case, don't lose the case. If you lose a cervical spondylosis case, you lose lot of money. Thank you once again to the organizers, Dr. Kalyani, Dr. Bidyut Mukherjee, Dr. Ghosh, and my co-speaker. Thank you.
Really, sir, we are greatly helpful. Many thanks to Dr. Nanda. And one thing I like to tell all of you, how many of you are carrying number of books behind your seat in the classroom? I have never seen or heard any second person than L.K. Nanda. And the number of books to him is proportionate to the level of teacher. He was my senior, next senior. We had mathematics classes jointly. So almost every day he will carry few books behind his. At that time there was a chair, table and chair. So he will carry few books behind his seat and he will sit in the classroom just to know the reference of any mathematical symptom told by the teachers. I have never heard such type of student. And today I feel that his effort has been 100% successful. We will be learning many things from him. I request on behalf of alumni, sir, please come before us and share your experiences, by which every one of us will be very much helpful. Many thanks, sir.
Give me towards sometime. I will give a detail, basic, all things.
Sure,
I'll give
sure, definitely.
Yeah.
Definitely. We
Thank you,
arrange it.
Dr. Kalyani.
Thank you very much.
We met after long days.
Very long days. Long few years.
30 years.
And after 82, 1982.
Yeah. 30 years. Thank you.
Thank you. Bidyut, please request Dr. Bhattacharya to.
Yes, sir. May I request sir to guide whether to call on the next speaker, or we will sum up or moderate Professor Nanda's session, sir?
Actually, we should speak something on Dr. Nanda's lecture. But before that, I tell you, please call Dr. Dhanalakshmi. She is waiting for long. Let her complete and we will sum up all together.
Okay, sir. Okay. Thank you, sir. So please call Dr. Dhanalakshmi.
Yes, Dhanalakshmi ma'am, over to you.
Yes, Dada. Thank you so much. I'm here. Thank you. At the outset, I'd like to thank for this opportunity the Alumni Association, which is the president, Dr. Dean Kalyani sir, Bidyut, Pralayda and all. And I would also like extend my respects to our director, Dr. Subash Singh sir, Dr. S.K. Bhattacharya sir, who was my director, who was our director during my D.H.M.S days in NIH. I would also like to extend my thanks to and respects to my seniors and my love and affection to my classmates, friends and juniors here. And I also would like to extend my humblest respects to my teachers, Dr. Shomendra Adhikari sir, Dr. Sarkar sir, Dr. L.M. Khan sir, Dr. S.Z. Khan sir, of course, Dr. SKGM and LKGM sir, who is not here. And we were very privileged to have our allied medicine teachers like Dr. Samir Mitra sir, Dr. J.B. Mukherjee sir were all doyens of their science. And I also recall now Dr. S.P. Dey sir, who was in Salt Lake, whom we accessed, Dr. S.K. Dubey sir, Dr. Mahendra Singh sir, who had let us to come to the residences even to learn from them. So thank you all. Good evening all for this opportunity. Hail Hahnemann was bestowed us with the best of the healing sciences, the homeopathy. I would like to start my session. Shall I share my screen, sir? Arko? Shall I share my screen now?
Yes, you can, ma'am.
One second. So today my topic is Nectar of Boger. So why did I choose Boger? I'll explain it later. Let's go to the
Ma'am,
next
please
slide.
click on the hide option, ma'am.
Hide option, yeah.
And Please turn on the slideshow.
Slideshow.
It's below. It's
Yeah.
below on the right side of your screen, sir, or on the top part.
Yes.
From beginning or from current slide? Yes, ma'am. Continue, ma'am.
Yeah. Okay. See, homeopathy is a beautiful science, and we all appreciate it as we apply it. We all see this results coming up, and we all appreciate it. To appreciate that requires a rightful application of the science. Is homeopathy really simple to understand and apply? I think it will be simplified as we know the process of simplification of the beautiful science. In Aphorism 148, Master Hahnemann says it's a laborious science, and we all know that it is a dense literature. All of us are put up with whatever is the disease like. We are put up with the in front of us, whatever may be the disease condition, be it common cold or cancer or anything, we are put up in a new situation and we need to handle it handle every case afresh. So to do that really requires an elaborate study. So for this, Master has suggested accessing to source books. Source books, we all know accessing to Mature Medica Pure and other source books is really laborious. To have a shortcut or to have it simplified is to follow the followers of Master Hahnemann. I would mention here Dr. Bonninghausen, Dr. Boger, Dr. Kent, and many more, Dr. Kner, Dr. Herring, and many more. So to follow them will simplify us the process. So without any more ado, let me enter into the this thing, my presentation. Why did I choose it as Nectar of Boger? As a honeycomb which harbors the nectar in a simple but successful structure, repertory of BSK is the most potent rubrics in a nutshell. Dr. Boger, in his foreword, says, scope of these rubrics reaches far beyond the appended synoptic text. As the hexagonal structure of the honeycomb, repertory of BSK's compartments full of applicable data in its entirety. Dr. Cyrus Maxwell Boger, an American homeopath and a versatile German scholar who was fortunate to witness, learn, and contribute to the works of both giants of homeopathy, Dr. Bonninghausen and Dr. Kent, in addition to accessing the original works of the Master Hahnemann. Understanding both the stalwarts' ideas, Boger came with a simplified but sharp synopsis of the application of the inputs of both mathematical and repertory, strengthened it with his own philosophy. Patients used to report to him from various parts of USA because of his ability to prescribe medicines even in incurable diseases marked with common symptoms. That we need to really note. With common symptoms, he was able to really treat those cases. He says, Boger says, correct prescribing is the art of carefully fitting the pathogenetic to clinical symptoms. It requires special aptness in grasping the essential points and symptom images, great drudgery in mastering and working knowledge of a large mathematica, and more skillful use of a reference works. Boger's synoptic key simplifies this process with precision. You will appreciate it as you start applying it. BSK is a classical construction of philosophy and tool to be used at the bedside. Application of Boger's synoptic key requires understanding the structure and construction, familiarizing with the book in terms of its mathematical repertory, including the supplemental reference. Knowledge of different methods used by masters in the application of synoptic, exploring the concepts of time dimension, tissue affinity, and pathological generals. These are sort of a theoretical portion. I am happy if many of you are aware of Boger's synoptic keys outlines, but I am extending this to those people who are not aware of the Boger's synoptic key, because I see there are some juniors and students are also watching this. So let me continue. Appreciating the value of synopsis and significance of having the related rubrics in nutshell, depicting the depth of how it runs in and through. Analytical repertorization with BSK is best utilized so as to form a pattern of the sickness. If an entity runs in and through the SIG, that is, 3 or more systems are affected together, that is reflective of general. It is considered as reflective general. Scope of this rubrics reaches far beyond the applied synoptic text, as I told you. So this is the layout of the BSK, which has the analysis part, a short repertory, and then synopsis part, which is the Metro Medica part. And the part 3 is we have the duration of action of remedies, complementary remedies, antagonistic remedies, supplemental reference table, etc. So how to really pick the keys to solve the BSK, Boger synoptic? Pick a strain which runs in and through. You will get to know as you see my cases, how did I pick the strain which runs in and through? Because Boger is a man of few words. What Kent says in a page, Boger says in few words. So to really understand and appreciate and apply Boger synoptic requires an in-depth understanding and study of the book. So you need to really pick the strain which runs in and through. This doesn't mean that we will simplify the process of case taking. The process of case taking will remain the same. We will be taking a complete details of, including all the details of the case, including the present complaints history, of present complaints, past history, life situation, whatever we take in detail, that should be taken. But while taking the case, you need to know what is the strain which runs in and through the case or the patient or the sickness. And as you pick the strain, frame it around the picture of the disease. It can be either a pathology, even a pathology can be taken as a input here. You can take a pathological general, a mind, a mental state. What I mean mind and mental state is the mind is a trait which a person has. Like, a person is generally calm, but mental state is the state during his sickness. A person becomes irritable during his sickness. That is his mental state. That does not remain permanent with them. The mind is, to put it in plain terms, that's like character of a person, you can say. So mind or a mental state, either of this can be taken. In my cases, you will see both these are applied. Or it can be a general sensation which is run through in and through the whole case, whole patient, whole sickness. It can be a modality, a prominent modality, a well-qualified concomitant, or even an epoch. What do I mean by epoch? Epoch is like, pregnancy, child, infant, old age, senility. We have rubrics called senility, old age in BSK, which is very unique of it. And we have child, infant, which I have used in my presentation. You can see. You can just take an input of that as an input and apply it to appreciate the result. So now, why did I choose BSK? All the way I was learning from Kent, N.M. Chaudhary, and all those, and I was applying them, and the success rate was quite good. I was able to keep my patients happy for many years. But there were some trivial complaints which we usually, even our own complaints, we are not able to really cure. One such complaint was like, I had a small, I don't know if it was an injury or anything. I had a pain in my index finger, which, right index finger, which that it's the most important finger in our hand, by which we use for typing or reading or writing. It's one of the dominant fingers in our hand, right index finger. I had a pain, and that pain was running for 10 to 15 days. I tried arnica, I tried ruta, depending upon the modalities. I did lidampal, and then I thought maybe it is an impending impending separation. Then I took silica, heparsol. It was not coming down. That is when, one of my teachers, he came up and he extended his help. And he said me, you can apply BSK. Just take two prominent things. So he took generalities suppuration. Why suppuration? I was not sure why suppuration was taken. But the position hanging down was very prominent. It was aggravating me because I was holding the finger up. And these two, when put into the Boger synoptic key, just 2 feet of these two. Generality suppuration, you can verify it from the Boger synoptic key if you have the book with you. And position, conditions of aggravations and amelioration, you see positions and go to hanging down, aggravation. Only Calcutta comes. I was astonished. Calcutta for me, I was all the way pulsatla or silica or something like that. The drug picture says that. I was always on those drugs, maybe an anatomir or something like that. I was wondering how come calcarea carb can cure me. This calcarea carb was advised on 30 potency. I did not have calcarea carb 30 because I always give constitutional prescription in higher potencies with the habit of Calcutta NIH. With higher potencies, we were very confident in giving a 201 m. So I had only 200. That night I took calcarea carb 200. The pain, which was persisting with me, it was really disturbing me. It was very acute and really disturbing my life. Went off within maybe I can say 15 to 20 hours. It just went off. I was astonished. How come calcarea carb cured this pain? Not only that, the background. I had many other complaints which I was generally suffering from. I had a gallstone by which I had an indigestion problem. I used to have flatulence, and then there was a bad dysmenorrhea I was suffering from because of a cervical polyp and a menorrhagia. After this calcarea carb, I took the calcarea carb 200. I just took one dose and I appreciated the pain is gone and I was moving around. I was learning from BBCR actually, Boger bonding was a characteristic. I did not bother to know Boger synoptic. As I moved on, probably in the month of February, I took this medicine. In the month of April, we went for a summer vacation to a place where I had to climb. It's like Dubai. If we went to Dubai, there is a tower called Burj Khalifa. It is around 170 plus meters height. I had always had a fear of height. After going there and coming, even entering the flight and coming back, I thought, hey, I did not have this fear at all. I had such a bad fear that I could never even climb my car when it goes on the ramp. I used to ask my husband, stop here, I'll get down, and the car goes up. So that is how. And the fear is gone. So this was telling me something that calcarea carb is really working deeper. The acute remedy is probably covering my chronic condition because there was no dysmenorrhea thereafter. I did not have flatulence. The flatulence was considerably less. I was able to eat my food, all 3 meals, which I never did in my life. So this really provoked me to learn Boger synoptic in detail. That is when I started learning it and started applying it. So without any more this thing explanation why I chose Boger synoptic, let me get into the case. This is a case of recurrent congestive cardiac failure, coronary artery disease, as you know. The congestive cardiac failure is a resultant of coronary artery disease. He had diabetes, chronic kidney disease, bronchial asthma. All these were, he has multiple morbidities. So this person was suffering really bad. I will give you a small introduction about this person. He is a leader of the Government Employees Association in Pondicherry. He is a very capable leader, very able leader, but he was lastly hospitalized during the COVID times, and he was having a very bad dyspnea. The dyspnea it was an acute dyspnea. He was not able to lie down, even to sleep. He used to sit erect day and night for fear of suffocation since almost last 45 days. He was a man who was always working, who was always active. Uh, Lying down in bed, remaining at home was really pathetic, and he happens to be my father's friend. So hearing this, I just went to see him. I was not sure that I could help him. I just went as a family friend to see him. So I saw him and then asked him like, "Shall I help you?" And he said, "Why not, ma? Please go ahead." So then I took the case. So he had an acute dyspnea, as I told you already, and he had a heaviness in the chest, which was describing very badly, and he was almost on the verge of shedding tears. There was a sense of congestion in his chest. It starts in the chest and it raises to his throat. This happens when he sits for eating. When he sits for eating, he ends with a cough, and with that cough, he is not able to lie down, not able to talk, not able to do anything. Only thing is he was just sitting erect day and night. This was really disturbing the whole family. And this short, dry, suffocative cough, it was probably a cough of the congestion of the chest, actually, which was relieved, temporarily relieved with sips of water, drinking sips of water. He had a very anxious, panicky feeling due to the loss of sleep because he was not able to lie down and and he was weeps on thinking of this. He wept on thinking of this frightful state. Otherwise, he was not a person of this state. And he was taking 5 to 6 sorbitol on his own, in addition to the regular twice a day dose, without relief or sleep, because he was feeling that he's almost going to die. You'll see the video where he'll explain himself that it is almost a terminal illness and I'm not going to survive, sort of that. So this person, you can see in the slide that there was a breathlessness and he's congested, and there is recurrent CCF with edema. There was waterlogging, and he can see that he had acute coronary syndrome, and he could not walk even few steps. That was his state. He was literally bedridden totally. This slide shows that he had very recently, this is on 31st of July, when he was admitted in the Pondicherry Institute of Medical Sciences, which is a reputed hospital, with congestive cardiac failure, coronary artery disease, and all those things which I had already described to you. But the presentation was very bad. She was really helpless. So I thought, like, okay, let me take help him. Although his present state is very helpless, he is basically a man of clarity. He had solved multiples of problems of the government employees. So I took the rubric mind critical, exacting, and then I took respiration difficult, suffocating, choking, etc. Then the conditions of aggravation and amelioration, lying, aggravation was taken. Only these 3 rubrics were taken from Boger synoptic. This is how we work on. Whatever is a pathology, as I told you, which is a strain which runs through and through. The strain which runs through and through is in him was the difficult respiration. He had acute dyspnea. That was his difficulty. And I got a formula from my teacher who had taught me this, that you'll have to pick general and the mind, either the mind, general, or the mental state at the time of sickness, and then conditions of aggravation and aggravation. With this, I'm working with lots of cases, and then it gives the result of one remedy mostly. Here, I would say that I would like to also say that I have not given away, kept away any remedy because of its lower gradation. I have included all the repertory, all the remedies into my repertory session. It is a continuous elimination process sort of. And the remedies included here are not only from the main repertory portion of the Boger synoptic, it is also from the supplemental reference altogether. Like say for mind critical exacting, there are no supplemental reference remedies. If at all it is there, that will be included into this repertory session. So altogether, complete list of possible remedies in Boger synoptic was taken and calculated. The remedy which came up was on adding mind and respiration difficult. There were 2 remedies, arts and self, and then on adding lying aggravation, got an RSAL. So I applied RSAL. RSAL 01 was given on 8/9/20. So on 19/9, I just called him casually to know, how are you, mom? He told me, no, ma, your medicine really works. It's a wonder. I'm feeling good. I was really surprised. Are you sure? Then he said, no, I have almost stopped my sorbitol use. It is really working. This is the first time that he's taking homeopathy. So he said, my congestive feeling has reduced, the dyspnea has reduced considerably. He could sleep well, eat well, even without getting the congestive episodes. He's put on arsenic ARB thereafter, the steady overall improvement. Additional sublingual nitroglycerin, that is a sorbitrate was withdrawn. That itself was a great relief for him, because every time he gets a congestion, he was gulping those sorbitrate, sublingual tablets. That was really worrying for his family also, because that is a medicine which is supposed to be taken for an angina like condition. So thereafter he was able to carry on with his daily activities like gardening, even attending to office works. And you could hear him after 03, he came over to my clinic to say thank you to me, and then I took a small testimonial video. You can see that. Here I would like to explain why I took the rubric critical thinking. Critical thinking is self-directed, self-disciplined, self-monitored, self-corrective thinking. He was a person who was like almost a single man army sort of, like, he was helping lots of government employees. Without him, he is still an honorary member for the Confederation employees. So kindly listen to the audio, which video. It is in Tamil. I will translate it after this, but he will pick up English as he starts speaking. So you can listen and appreciate how he felt.
I am down with sickness. Terminal
Yes, ma'am.
terminal sickness. After the Swami though I had tried the other medicines from the hospital, but
Triple M.
this feeling and condition so it was a worrisome issue. After consuming medicine, I felt better. Not only that, even before that, taking food, I did not have the appetite. Just for the sake of taking food, I was taking food. The whole situation has changed. And
It's an extension of that video here. One more.
so it has given a new boost and energy to me to continue my association and social causes. Along with this, you have been doing this ecology issue, water preservation, reseeding of ponds, channels, planting of trees, movement against plastics, all these. And I have been trying to see that it does not stop with me. It has to be taken as the legacy of the Confederation and myself to the entire body of the government employees affiliated to the Confederation. To that extent, that this medicine have improved my outlook, it's improved my health, and improved my confidence. So I think that with your next dose, I will be more in a better way to do my service for a little more time.
I'm so happy, Mama, to have helped you. And you're a good friend of my father. And many of my Calcutta comrades are also your friends. And thank you so much. Can I just use this for medical purposes for education?
Definitely, absolutely.
Thank you. Thank you. So that was his expression. You should have seen him like before the sickness. He was in a very bad condition. He was really desperate. People were thinking that he will not come out of the situation at all. So after the medicine arsenic album, he had profuse urination, which relieved his edema. I did not click. I did not bother to really click the snap or take a video of him because he was almost in his terminal stage. I was really shaken aback. I did not bother to take a video, but he had a very bad edema and sick. So after the medicine, he came down with a profuse urination. This discharge really relieved him, and his condition is relieved. I hope we can all appreciate that he's healthy now with ourselves. And I'm continuing ourselves till all the complaints are withdrawn. I'm expecting some changes to come up in his eco also. But this is an example how with a minimal input a remedy can be worked out, and the remedy can be curative for the at least the present condition. The present condition of congestion, dyspnea, cough is relieved with few doses of ourself. I started with LM potency. If it was centesimal, I would have held on with one dose, but it is an LM potency, as Master Hahnemann has said. We need to continue it till we see the end aggravation. So I am continuing it. Let us see how. Possibly I'll explain this in my next presentation, if at all. Okay. Anyway, so now let's go to the case number 2. And this we had a discussion about this boy in our alumni association group also. So I have I'm successfully treating him. So I would like to share this with all other friends who have joined me here. This boy is 22 years old. He suddenly developed dry, scaly rashes all over body with intense itching. Complaint started after a severe episode of continuous high fever 3 months back. He did not have any past history of skin disease. Itching and dryness was aggravated in the cold day exposure. Evening onwards till night, it was aggravated with inability to sleep. This boy came to my clinic, and he was sitting in the AC. He was not able to sit at all. He was just moving out. He was saying the air, whatever air, if it touches my skin, it really itches me. The itching was so terrible, and it was so pathetic to look at him. So here for this case, again, I'm applying the same formula of generals, there's conditions of aggravation and amelioration, and one mind, which is very prominent in these. These cases are all taken in detail. Here I'm sharing only the salient features of the case. This doesn't mean that I'm taking a very short case technique. I'm sharing only the salient features to appreciate more of the repertory portion and repertorization portion and the methodology rather than the details of the case. So if anyone interested, I can share them to the mail, the complete details of the case. Now, for this case, I have taken the general skin itching. I have even mentioned page number 101 because I do a manual repertorization. I do not use any software. And then conditions of aggravation, amelioration, dry, clear, or cold weather aggravation. And I took mind placid, tranquil. That boy, in spite of itching or anything, he did not complain anything. He just went out. He was waiting calm. Took 10:45. He entered my clinic around 8 o'clock, and it was around 10:45 by the time he entered my table. He was completely calm. He came with the sister. I asked him, was he irritable? She said, no, he's always calm. I don't know, only the skin is disturbing. Then I asked, did he get irritable after the skin itching started? She said, no, day and night we are seeing that he's not sleeping and itching, but he doesn't get irritated. In fact, we are feeling pathetic for him. So this mind was very prominent of him. This is probably his nature also. So here I took mind placid, tranquil. So if you add 1 plus 2, that is skin itching with dry cold air aggravation, you get aconite, causticum, and sepia. And if you add the mind, you get only sepia. Sepia 01 was started. You can see you can appreciate how he's doing now. Follow-up one is 11:10. Itching reduced considerably, rash, dryness reduced, but the rash is coalescing. It was sort of increasing. Like I was worried whether it is increasing or decreasing. Although symptomatically he said, no, I'm sleeping now and the itching is reduced. But I was little worried because his rashes were all coalescing and it was expanding to all over his body. And then I continued sepia 02. As it is an LM potency, I continued it. Follow-up 2 on 9/11. That is exactly almost like 1 month after LM2. Itching and dryness is also reducing considerably. Sleep improved. Overall rash is getting reduced and skin becoming moist. Still, I continued giving sepia 03 because I'm expecting some discharge to come out, which shows an either or an end aggravation, which will clear up the process of cure. So till then, I wish to continue sepia. In case the picture changes, maybe I will change the remedy. Otherwise, I wish to continue sepia 01. We can see the scaly hypertrophic skin here. It's probably a lichen planus. The dermatologist has diagnosed it as psoriasis, but the acute itching state tells me that it could be lichen planus. You can see the difference. In a matter of 2 months, with a few inputs, the remedy was worked out. And the results you can see here. You can see the rashes were here bad. And you can see the congestions here. It's all red, and then all this congestion is relieved and the skin is getting better. This case, I hope many of you may be remembering that we discussed it for its diagnosis in our alumni group. So this boy is on the process of cure. He's progressing well. Hopefully, he will get cured with uh, a discharge appearing. Till then, I wish to continue it. So just hear him. It's a small testimonial video where he says he's 80% better.
அப்படி வேற எதுவும் தொந்தரவு இருக்கா உடம்பு ரீதியா? இதை நான் மருத்துவத்துக்காக பயன்படுத்திக்கலாமா இந்த வீடியோவை?
So this is a small thing in Tamil only, but you can appreciate that he's saying I'm 80% better. And you can see the air is blowing on his face. Still he is not disturbed. The first visit when he came, I had to switch off my fan and I had to switch off my AC, which was not able to tolerate it at all. So now let me get into the case of a beautiful case. This is a case which I did through Skype. I did not even see the patient. The patient is an infant. She was born on 24/6. She was a premature baby. The mother could not really tell the gestation age, but it is probably 24 to 26 weeks. But here the point is, a baby born before 7 months of gestation will have a um, will have a poorly developed lungs. So this baby was in NICU, intensive care unit, and she was having breathing difficulty on oxygen support. There was generalized edema, suppressed micturition. The heart rate was on the higher side, 184, respiration was 81, SpO2 was 94. She was put on oxygen support. So what am I to do here? This baby did not come for my consultation. She came for homeoprophylaxis to one of my friend, Mr. Martin in Netherlands. He happened to see the baby. Then he felt that homeoprophylaxis will not any prophylaxis which they take in place of vaccination. Those people will not be suitable for this baby because the baby has very bad vitality. So giving a prophylactic medicine at that time will not be beneficial for the baby. So what we thought is we planned it together so that we treat the baby first. We make the we recover the baby out of the acute state, and then maybe probably if at all she requires, we will extend that help. So this baby came to me, and as he was a little finding it a little difficult to treat, he took my help, and we worked out the case. Here in this case, again, as I said, the inputs are minimal, but the cases are taken in detail. I took all the details, but for this case, I could not see the patient. The mother was not able to convey anything because she was in complete distress. Because her child was in intensive care unit. All I took was I took the epoch. You remember I mentioned the strain which runs through epoch. I took generalities, children, infants. This is one input, one rubric. Then generalities, dropsy, edema, etc., which is there in generalities. Respiration oppressed, micturition, retention, suppression, tardy. After working out this, I do a manual repetition as I told you. So pulsatilla came up. We gave pulsatilla fractional in breast milk for the baby. After pulsatilla, the baby who was still on diuretic from the month of June till August, she was on diuretic. Still, she was not throwing up enough fluid. She was on a surfactant. Still, her lung function was not improving. So after pulsatilla, I have got few videos of her. You can appreciate the changes, how the respiration has improved in her. Excuse me. Yeah. So you can see the baby. This is on 13/8. I asked the mother to send me a small video. So you can just see the baby has ascites, sort of an inner. It is not an ascites. It is an inner circle. There's a complete waterlogging, generalized edema. Okay. So you can see that the child is really struggling. She's put on oxygen. You can see those oxygen tubes. Still her SpO2 was 94 only. After we started the treatment, her heart rate reduced, her respiration rate reduced, her SpO2 improved, and urinary output improved. This was the only thing which the mother could appreciate. Other things were all technical. She sent me slides of her monitor in the hospital. I could appreciate that, but only thing which the mother could appreciate was that the diaper was always dry. The diaper which they placed was always dry. It was not draining. You all know that for an infant, the output of urine is measured by measuring the weight of the diaper. The urine output improved. That was showed in the weight of the diaper being increased, and they could see that the oxygen support was also reduced to 50%. You will see that supported document from the hospital, and the child was able to sleep good. She was very restless after that. This is exactly 1 day, 2 days after. So you can see the calmness, the child, you can see the oxygen support is taken off, the child is doing well. So I was happy. We just left it. I said pulse at 200 will take care of it, and let her, like, she will be discharged soon. And this was so happening. And then after a few days, uh, every day I ask the mother to send me videos of how is the child, because they may not be knowing any changes. I wanted to appreciate even the finer changes which is happening in the baby, which they may not be able to pick up. So every day I've asked her to send me videos, and the mother was sending me videos. But as she sent me the videos on 22/8, I could see the child's abdomen was intensely distended, but she was not noticing it. I noticed it, and but the urine output was normalized only. The respiration was little rapid and short and noisy. The child was in trouble, but they were not able to really sense that. Sleep, the child was also screaming incessantly. Probably they thought it could be a colic abdomen, because the child was put on caffeine and all other remedies, all other drugs. So they were not sure of why the child was crying. But I was sure, that the distension in the abdomen was disturbing her. So you can see that and appreciate that in the next video which I'm showing you. So as I saw the distension abdomen, I took flatulence obstructed. These were the only two inputs taken without even taking any other complaint from the patient. This is objective. This is the strength of Boger. Boger relies more on pathology. Boger relies more on objective symptoms rather than subjective. I would say he appreciates more of objectivities also in the absence of subjective symptoms. So here, flatulence obstructed retained was taken, and respiration loud, noisy. This I could see from the video. Then the previous video, the child respiration was loud and noisy. I asked the mother, she said yes, yes. They said it is probably she's having difficulty with breathing. But I could finally differentiate the respiration of the first video and the second video. So I worked out this. The remedy came out where chamomilla and cinchona officinalis. Chamomilla and cinchona officinalis. What to really sort it out? I did not get anything more from the input. So I had to really differentiate between chamomilla and cinchona. So I started interacting with the mother. Every day I spent some time talking to her, chatting with her. I asked her what else. So to differentiate this, I was asking her prenatal history. So in the prenatal history, there was a history of severe bleeding followed by miscarriage in the previous conception in the mother. This gave me a clue for cinchona. When with cinchona 201 dose, mother's milk, that is also a split dose, because they had to give it in the mother's milk only. The child was not able to suck. Suckling reflex was very poor. Not poor, the baby did not have the suckling reflex. It was all fed. Of course, under intensive care, they preferably want the child to be fed that way. So after cinchona, you can see how the child. And this is before cinchona on 22/8. You can see the distension of the abdomen, and you can see the faces were also full, but it was not edematous. and you can see the tongue is protruding out. As I switch on the audio, you can hear that the noise, the breathing will be very loud and coarse and noisy. These inputs. Oh, sorry. Okay, so I took these two rubrics, and the remedy worked was China, and after China, you can see how did the child improve. The flatulence and distension abdomen reduced, respiration improved considerably, and child who was sort of annoyingly crying consistently, like improved better, and she became calm. The mother sent me she's like a Zen Buddha sleeping now. So that was the appreciation from the mother. So on follow-up 3 shows. You can see this is on follow-up 3. Okay. So the child started improving, and then she was progressing well. This is the patient case sheet, discharge summary from the hospital. After this, due to like some issues, the mother could not contact me, and she really, I would say that she discontinued the treatment. But our period of treatment was between August end from 1/9 to 24/9. You can see there was strong weight evaluation, and she was on low flow. The oxygen support was reduced, caffeine was stopped, and uh, the child. This shows that the child was steadily progressing. But then again, the child developed severe bronchopulmonary dysplasia, and we had to repeat the dose. So then again, things settled. After this, she was discharged from the hospital. This is how the child was, and you can see how beautiful she is now after the treatment. But the story didn't end there. After coming home, the mother then suddenly, I asked her, "How is Ellen?" She said, everything is fine. She's peeing better. Peeing is like she's passing urine better. She's passing stools better. The only thing is she's having a abdominal cramps. I think that's okay. But then I said, why should you say it is okay? If it is disturbing the child, you should help her with remedy, as you see that it has helped her. Yes. Then she said, okay. Obligingly, she obliged to that, and the child was having probably an abdominal colic. We don't know why is the child crying. The child weeps after breastfeeding. No, and the child here started having a breastfeed, started having the sucking reflex, sucking very well, and she was no more supportively fed. She was feeding on her own. The mother was so happy that she's able to feed. That was the she was very satisfied. That much was enough for her. But I was not happy. I felt that the child has to be relieved of this complaint also. Then I told her we can help her out. So she was more weepy only in the morning. After she gets up, she was more weepy, and the abdominal colic was there in the mornings. They probably thought she's hungry, or that she's so she's so hungry that she really drank so much. And the mother was saying, "We don't know." I really don't know. She knows the limit. She drinks so much, and there is abdominal colic. But I was not accepting that one. Maybe the child is greedily drinking, but at a point it will stop. As the appetite, hunger subsides, it will stop. As it was giving a pain, I thought, okay, this should be helped. And for this abdominal colic, after feeding, the mother took her out in the open air when the child stopped screaming little bit. But only position which was helping her really was the mother has to. I've seen the next photo that she has to put her hands and pressing the abdomen, and not just on the abdomen, lying on abdomen. She's put on the cot, she's not okay. She's put upside down, anywhere else she's not okay. Only thing is she wants the baby to be hung, pressing against the abdomen. So this I had to take the help of BBCR because this is very specific. I did not find this input in BSK. So I took aggravation amelioration chapter in BBCR, Boger Burning and Characteristics Repertory. There's a fine rubric called aggravation amelioration, bent holding the part amelioration, carrying amelioration. I took, and the remedy was colocynth. Colocynth was given in divided doses, and the next day the child got relieved. It's almost just hardly 10 hours. The next day, this is the position the child wanted to be held, nothing else. We had a Skype consultation. The mother had to hold her against like an abdomen, pressing against the abdomen on the genitalia. So I'm not sure where the pressure has to be, but she said I'm pressing against the abdomen. But I asked her, is she okay if you put on the abdomen? She said no, she wants only this position. So I took that rubric, and this really gave her relief. So crying not so much anymore. This is a chat from a mother. Bowel, I can hear often still lots of gas is there, but the child started passing stools. Earlier she was passing 1 to 2 stools, and then she started passing stools much better. I asked her, does she still want to be held like this? No, not so much. The mother was happy, and the child is happy now. So can I proceed with one more case, Arko, Bidyut? Hello. Bidyut, can I proceed with one more case, or should I stop here?
You proceed. One more.
Okay. Thank you, Bidyut. Okay. So this is a case of a doctor who was diagnosed with rheumatoid arthritis. The point here is not treating all these pathologies. Many of you would have treated these pathologies in different methods. The point here is the method which I'm working it on, the simplified process of applying the whole case into few rubrics, which really gives you a remedy, a curative remedy. I will be happy if any few of you would appreciate this and start applying it, and that will be the success of this presentation. This I will stop at this case, and this is a case of one doctor. She was diagnosed. She is diagnosed rheumatoid arthritis since quite a long time. So it's almost 10 years, sort of. She was suffering very badly. Her ankle joints, knee joints, all those deformities have started appearing, have disappeared. She's a homeopathic doctor also. I have all these details of her. There was pain and swelling in both the wrist joints, including small joints of the hands, knee joints, ankle joints. The pain was of throbbing, pulsating nature, which was relieved by heart pressure. She used to say that, when she lies down on the cot, she has to press her hands and the legs against the hard surface, the edge of the cot, which only gave her relief. Nothing else really gave her. The pain was acute. She was not able to touch, but then she had to press hard against a hard surface, which gave her relief. And then she had to pour hot water, which relieved her. And a whole day she was working. She works in a PhD also. The whole day it's okay. At night this pain starts, and she has to really press against everything. The deformities were really disturbing, and it is all progressing in all the affected joints. There's pain and stiffness in the neck joint. Almost all the joints is affected in her. She's irritable during the pain, wants to shout and hit someone. thoughts recurring of past bad events. These are again the salient features of the case. I'm not presenting the complete case for want of time. All these complaints are there worse since 2014. She's generalities. She is extremely hot, has burning eyes, palms, soles, but she desires hot bathing. In spite of the burning sensation which is there throughout, she desires hot bathing, hot foods and drinks. Skin feels hot and dry to touch, and desires an aversion portion. She likes the she desires spicy condiments, biryani, sour food. Aversion was there for cold drinks. Very cold food she didn't like, and there was very scanty sweat. She always said me like, I want, if I could sweat well, I feel that all this would be relieved. She always wanted the body to sweat, so she used to work voluntarily to sweat, which really gave her relief. Her bowel was constipated. Uh, the bowel movement was once in 2 or 3 days. It was at hard stools, balls. There was bleeding on straining with pricking pain. Thought fermentation relief for this pricking pain in the anus also. So sleep was surprisingly good. She could sleep well, but there was grinding teeth during sleep. There was dreams of flying, being chased by elephants, running, not able to complete exams. As it is, if you take the character like a mind, she is generally soft spoken, sort of an introvert. She will not speak much. She was very close with me. She could express. She had taken medicines from lots of many are of her senior doctors. She's from some other college. She's taken medicines, and she was always brooding on the past. She was not getting any relief. She was on painkillers, and she was on other steroidal remedies also from the rheumatologist and immunologist. Her menstrual history was regular in 3 to 4 days. All pain in the joints were better during her flow. So this is the input. There's an enormous input. So I tried to work out. She was worked out on BBCR, but she was not getting relief. And I thought, okay, let me try with the simplest formula, but the sharpest formula of Boger synoptic. I took again generals. The throbbing, pulsating was universal in her body. Throughout there was throbbing and pulsating, and this pressure amelioration lying on affected part, etc., which is another rubric which you took. Conditions of aggravation amelioration, which is pressure amelioration, you can see lying on affected part amelioration. Discharges amelioration. When she was menstruating, she was better. When she passed through, she was better. When she sweat, when she voluntarily did, she was better. So it took discharges amelioration, and the mind was, I took mind memories disagreeable recurring. This is the mind state, the state of the mind at the time of sickness. This is not her nature. Here I took the mind state of mental state. All this worked out to show sepia 01. Sepia 01 was prepared, and now she's still on sepia. She was on sepia, and you can see the RA factor, which was 226.34, has reduced, and you can see it was less than 10. The treatment was 1712 to 2019. That was the previous report, and then after treatment, it came down to less than 10. Then I repeated it again, 8/2020, in the month of May and in the month of August. She was steadily progressing. Clinically also, subjectively also, the pain was improving. Bowel movements were getting better. The beautiful part is she started sweating, which she really felt good. And then after the sepia 1 and 2, she started having diarrhea. So I can see that this I will explain later on. I wanted her to sum up what happened after the remedy. Medicine started first day, ankle swelling and pain, knee pain and swelling is still present, unable to walk. Second day, same pain. Third day, unable to tolerate pain, taking painkiller. Fourth day, feeling better. Fifth day, pain tolerable. Sixth day, diarrhea full day, 10 times pain, feeling better. Seventh day, pain and swelling reduced, 4 times diarrhea. Mentally relaxed. I called her up. She was my colleague, and I was really worried. What am I doing with her? Am I really helping her? But she said, Madam, I'm really happy that in spite of the diarrhea, I'm feeling good, I'm feeling relaxed, and all this pain have miraculously really gone. And all this pain steadily progressing. Not only this, now we'll go back to the previous slide. She was trying to, she has a child, and she was trying to have another baby for almost last 7 to 8 years. She was trying, and she even conceived with the same remedy, which she did not do with any other previous prescription. So after her conception was confirmed with the EPT and the ultrasound, I stopped Sepia. I went with Master Hahnemann's direction of giving 1 dose of sulfur in the month of 3rd month, probably the first trimester. In the first trimester, I gave her sulfur. Until date, she's almost in the 8th month now. I'm not giving her prescriber or anything. She's just on the mild painkillers now and then, SOS, because she's working. Otherwise, even she was diabetic. The diabetic level also got reduced, but the gynecologist felt that she has to continue insulin, which I could not really tell her to stop, because that was important for her, because the baby was precious. She was longing for a long time. But rheumatoid arthritis status, the status of the polyarthralgia has reduced, polyarthritis has reduced, and she's doing better. Probably she's in the path of cure. Post-delivery, I will be continuing her either with Sepia, if that is indicated still then, or with some other indicated then, to take her into the complete path of cure. Here, the parameters are showing negative. RA factor has become negative. The patient is still symptomatic because of the longer, deeper disease. I suppose if it is the Sepia, which has been the curative remedy, Sepia 2, should cure her by the time she delivers the baby. If at all, I intend to continue the prescription furthermore till she is cured. So this I would like to end with this case because I think we are already late. The take-home message is Boger synoptic application is simple. As Master Hahnemann said in aphorism 148, study of homeopathic medical is a laborious task. It requires studying the source books, but the source books we all know is vast. So what I thought is studying the disciples of Master Hahnemann, who has brought out the nectar from Master Hahnemann in their works. Dr. Boger is one such person who has brought out the nectar in his works and successfully applying it. I'll be happy if some of you could apply and appreciate the results and give me the feedbacks. So thank you so much. Thank you, Bidyut. Thank you, Kalyani sir, for this opportunity. I'm glad, I'm happy to answer. I have few more slides. 1 minute. Let me just. 1 minute. 1 minute. As we are running short of time, I'm closing down all the cases, but I have my acknowledgements, which I would like to give to my teacher and my family. Please hold on. Kindly hold on. I would like to just express my gratitude to my teacher, Dr. K. Srinivasan sir, who had showed me this path of BSK, but insisted on finding my own ways. Respects and gratitude, sir. He's not he's not a teacher whom I got from National Institute of Homeopathy, but after as I started applying, learning furthermore, I got to know many other teachers. He's one among the teachers who has taught me BDCR and Bogerson Optically successful application. I hope I'm successfully applying. Thank you so much, sir. And then, so the message, take-home message is a well-selected remedy can cure the sickness, including exteriorization and discharges appearing. A well-selected acute remedy can be a curative of the sick, not the sickness. It's curative remedy of the sick as well. And this is my family, which is my strength. This is my father, who's my everything. This is my dad and everything. It's no more now. He has got me the best of the schools in the world, the National Institute of Homoeopathy. Reach out to my for your feedbacks on this mail, and you have my mobile number here. So thank you so much, sir. Thank you, Bidyut. I'm concluding here.
Thank you so much, Dhanalakshmi. And we'll be eagerly waiting for the moderation of Professor S.K. Bhattacharya. But before we proceed to that, we have a very common task to do on a regular basis. And I'll request Dr. Pralay Sharma to please come up on the screen and say a few words and an appeal on behalf of the Alumni Association for the Benevolent Fund. Dr. Pralay Sharma, Deputy Medical Superintendent of National Institute of Homeopathy. Over to you, Dr. Pralay.
Thank you so much. I think I'm quite audible and quite loud right now. As usual, whenever we be in the virtual platform, we have an announcement, and that too for the Alumni Association. And in fact, today we have been for a long period in this virtual platform since 8 o'clock. And I believe that this gathering, this virtual gathering, been very well conducted, and we are very happy to listen from Dr. Nanda sir, as well as we have with us today Dr. S.K. Bhattacharya sir, who has been always a strength for us, and he is basically a troubleshooter in our homeopathic fraternity. And we also have listened to our very beloved and very pretty girl of our institution, Dr. B. Dhanalakshmi. And I would like to use this platform to announce and to inform to all of our alumnus that for a couple of months we have been generating a benevolent fund for the alumni association members. Right now, as you all know, that we have with us in our alumni association around 2,600 number of members right now, alumnus right now, because we are very shortly we are going to welcome this 27th batch of D.H.M.S in our institution, in our hospital section, 27th number of internees, the batch. And we are very shortly we are going to welcome 22nd batch of postgraduate training. And we also have with us the deep NIH students by these three categories of the course. We have right now 2,600 around alumnus with us. And we are generating the benevolent fund for this NIH Alumni Association. We call that one is an NIH Alumni Association Benevolent Fund, and it provides support to alumnus in times of their unusual need. And in this this is generated and supported by the ex-students. This is basically a financial assistance to the alumnus in their prolonged illness, as well as in their death, in their death. So I will request all of the alumnus to be very generous to donate a small amount of contribution for this benevolent fund to stand in need to the alumnus family, as well as the alumnus itself. But I once again, what we always put the appeal to all of us, that we have only the 3 WhatsApp group right now. We are very recently we have started joining in the Telegram group, where the number of the members can be enormous, member unlimited. So I'll request all of the alumnus who are in touch with this WhatsApp group to be in the Telegram group, as well as to inform all the members, all the batchmates, all their friends to be associated in the Telegram group. So whenever we are announcing something, whenever we're doing something good for the alumni, for the association, that will be forecasted in a time. To talk about the benevolent fund, I'd like to focus into fact that the whatever fund is generated in the name of benevolent fund is not being spent to some other cause. It is absolutely wholly solely for the benevolent fund is utilized for the distress in case of distress of the alumnus. And whatever we spend, we put that appeal to the WhatsApp platform, and we take the permission of each and every a member of the WhatsApp group as well as in the Telegram group. If somebody have any objection in donating to some of the alumnus, he can put that objection there. We consider everyone's appeal, everyone's consideration into our into our system of donating towards the beneficiaries of our alumni association. So you can be very sure that the fund is not been spent for other causes other than this in support of the alumnus in their need, unusual need. This is all about from my side. Once again, I thank all of you in this virtual platform. And in fact, this is a great opportunity for us to see each other's in periodically in this platform. Thank you so much. Thank you so much once again.
Thank you so much, Dr. Pralay, for being so patient at the backstage for last 2 hours, 2.5 hours, and please be with us. Now over to Dr. Kalyani, sir, and our moderator today, Professor Samir Kumar Bhattacharya, sir, for moderating. I request Orko to bring both the speakers on the screen.
Thank you, Dr. Mukherjee and Dr. Kalyani. First of all, I want to say about Dr. Dhanalakshmi. I am very glad to see that she has developed herself with a very meticulous way and methodical way for her patients. Whatever she has presented, nothing on talk, all on record with the patient. It's very good. And I appreciate that if all the homeopathic doctors adopt this method, that they will only keep full record of their cases, they will study their cases in method, and they will practice like this. I think very soon we will have a good amount of evidence-based cases which will tell the truth of homeopathy. And I appreciate Dr. Dhanalakshmi for this. And she has presented very nicely some cases and few cases, and particularly her own case, what she has presented. It's very nice. Even everybody has learned it, and I have also learned that angle of prescription. Now let me come to the cervical spondylitis and Dr. L.K. Nanda. I'm telling you, I already told you, Dr. L.K. Nanda is a very, very learned person, and he has got a very wide range of knowledge in mathematics and other allied subjects. So whatever he has presented, I think there is nothing to add in mathematics part. He has told everything. And it is complete, and the students or the doctors who are following this seminar, I think they have learned many things. And even I have also learned something from his lecture. I have got nothing to tell something new about the mathematica in this aspect. But what I can add from my side, it is my experience, how I treat these cases of cervical spondylitis. I am telling you, this is from my experience. It may not be a rationale from the book point of view. This is my experience. Whatever patients I have seen of spondylitis, cervical spondylitis, usually I have seen that there are three types of patients coming to us. Number one, where it has developed as a pseudo-chronic disease. That means it is not generated as a disease from miasmatic point of view. It is from the some faulty structure, faulty sitting, using sofa, using computer, this, that. Those are the occupational hazards. Even I am telling myself, I have a very good or bad habit of going in high altitude trekking. And many occasions, after returning from high altitude, I have seen that I have got cervical pain. Even on X-ray, there were some certain changes was found. Severe pain. But I am telling you, these cases don't require any miasmatic treatment. Even symptomatic homeopathic medicines are also sometimes not required. Only you withdraw the maintaining cause and make some exercise, what I did for my cases, and got relief of the symptoms. So that is one type of case where your patient won't require any homeopathic treatment or any treatment, even miasmatic treatment also. But there are certain cases where the patient has developed from some occupational hazard, but there is a miasmatic background. There you will require homeopathic treatment, miasmatic treatment. This is my experience I am telling you. What I have told other than those. This is my observation that usually I have seen three types of cases again there. Number one, which have got predominantly syphilitic miasm, syphilitic background, and the symptoms are indicating some syphilitic background. There are certain cases where predominantly it is indicating some psychotic miasm. Psychotic medicine is required. And there are certain cases, I have not seen purely sodic cases, but I have seen some mixed miasmatic cases and predominantly soda or something. So these three types of cases I have seen. First category I have mentioned, the syphilitic, where the degenerative changes are more, osteolytic changes are more, and those cases where osteolytic and osteophytic changes are there. And these syphilitic cases, this is my experience I am telling you. I have seen many medicines, definitely. I am telling a pure case recording, a pure case analyzing, and a pure prescription on the totality of symptoms will cure the case. There is nothing other than that. Only thing, you cannot cure a typical type of cases only with your keynote symptoms. It may palliate. Sometimes accidentally it may cure. But for a definite cure, I am telling from my experience, if it is from the pure totality of symptoms, even a medicine which is not expected, you will see a cure from it. Dr. Nanda has mentioned bryonia. Yes, I am telling bryonia is a very, very good medicine if it is indicated. Simple medicine can cure a case even if it is found a natrum mute. A medicine like this can cure a case of cervical spondylitis on totality of symptoms. But when I was talking about the syphilitic miasm, I am telling my own experience of certain medicines. I am telling I have got very improvement or cure in certain cases. One of the medicine is Bidyut. Bidyut is a medicine where I have seen in syphilitic background and where there is osteolytic changes are more and osteophytic changes are more. Bidyut gives a very good result if it is indicated according to symptoms. Similarly, Mukherjee, I am telling this is another medicine which plays important role in the cure of cervical spondylitis, and you will see in headings guiding symptoms there are specific certain symptoms which indicates that cervical spondylitis covers the symptoms of Mukherjee or covers the symptoms of Bidyut. And another antisyphilitic medicine I have seen of many use, that is lysine. Lysine is a medicine which has cured many cases with some specific modalities we have seen. Similarly, in case of psychotic, I have told that psychotic cases also are there. I am telling you for psychotic cases, it's excellent remedy. Number one is thuja, particularly if the pain is involving the left side of the patient. That is very important medicine, thuja, in psychotic conditions of the cervical spondylitis. Now, there is another medicine where right side is affected, lycopodium. I have seen many cases cured by lycopodium with predominantly psychic symptoms, and these symptoms definitely without symptoms you cannot prescribe lycopodium or thuja or anything. So lycopodium, sanguinaria canadensis, chelidonium. I have cured few cases of cervical spondylitis only with chelidonium. And the peculiar thing I am telling you, the pain radiates to the right scapula and ultimately to the top of the shoulder. The top of the right shoulder, when the pain settles in a case of cervical spondylitis, I have seen chelidonium is a very important medicine and it cures it. So these are the medicines, and where particularly mostly there is multi-miasmatic backgrounds or the case is one-sided. The patient has come to you only with the symptoms of spondylitis and there is no other manifestations which you can take note of it or you can cure. Those cases we have seen certain medicines like Calcutta 4 is an important medicine there. Calcutta Tar is a very important medicine there. And Hekla Lava, you should not forget Hekla Lava, which has got a very good role in cervical spondylitis, where there is more predominantly osteophytic changes are there, even scar-like symptoms are there. Scar-like growth, spar-like growths are there. So those cases, Hekla Lava is a very important medicine. And these are the medicines definitely will help where when it is one-sided. That means according to totality, you cannot go there. Only there is certain symptoms. There are certain symptoms which is specifying the cervical spondylitis and which are specifying the pathological lesions which are present in your particular case. So these are the medicines. So once again, I am telling you, the session of Dr. L.K. Nanda in this particular subject was very excellent and rich in medical knowledge. And again, I am telling one thing, that we should not think on therapeutics. We should not think on specific medicines. We should not think that when Dr. Dhanalakshmi or Dr. L.K. Nanda or Dr. S.K. Bhattacharya has cured a case with certain medicine, it is a medicine for cervical spondylitis. Please don't think for it. you take it as a homeopathic case. And when you see a homeopathic case with the homeopathic outlook and you take the case properly, it may be even belladonna, it may be even aconite, it may be even zincum metallicum will cure your cervical spondylitis if you are methodical. Once again, I pay my thanks to Dr. Bidyut Mukherjee, Dr. D. Kalyani, Dr. Troy Sharma, and specifically another my student, Dr. Chandrasekhar Pure, on whose request today I have come. Usually, I am telling you, I have become old. In such night, usually I take my dinner by 9:30 usually and go to bed. So I am still sitting here today only on the request of Dr. Chandrasekhar Pure. He personally requested me. So I am thankful to all of you. You are all who are all my students. I bless them. God bless you, and you become the pioneer of homeopathy. With this, I end my speech. Thank you.
Thank you so much, sir. Thank you so much. And listening you after so many years, it's a it's a really pleasant experience. And we have few questions and suggestions from the speakers. I'll request Orko to highlight, and the speakers and the moderator, please, if you can guide or clarify the queries. Kindly tell about the potency.
Potency
Dr.
definitely
Ujjal Mandal.
For cervical spondylitis, I will request Dr. L.K. Nanda first. And for the Boger's point of view, Dr. Dhanalakshmi will tell first. Then definitely don't ignore Dr. D. Kalyani. He is also a very, very great prescriber. He will also be able to highlight regarding the choice of potency, and I shall also try.
Thank you. It's a very good question regarding potency. In all seminars, it is often asked what is the potency to be used. But regarding potency, I can say you that everything is very honestly and very rationally and very cleanly described by Hahnemann in Organ of Medicine. But what I have also shown you here in my slides that when my prescription depends on 5 factors. That is prescription based on personality character, prescription based on totality, prescription based on keynote, and prescription based on sphere function. When my prescription based on totality of symptom and prescription based on personality typing, then I used to give LM potency. Because these cases, totality and personality are classical prescriptions, and when the symptoms are uh, very much indicated to the patient, when there is a good simillimum, when there is a symptom of patient and the medicine are in tally and they are indicating nicely, covering both mental symptom, physical general symptom, that time the potency should be higher or should be LM potency. So I used to give LM potency in case of prescription based on totality and also prescription based on personality. So while prescribing on the basis of keynote, where I didn't get a totality of symptom because of advanced pathology in the case, because of there is lack of mental general, physical general, and I depend my prescription keynote. In that case, I used to give a lower potency 30, 200 likewise. And when in very advanced cases like myelopathy, like cervical radiculopathy, myelopathy, where there is a already damaged, the patient is on stretcher, unable to walk, or on the wheelchair. In those cases, no symptom, advanced pathology, no symptoms are there. So I used to give mother tinctures. So it is very clear, the more the drug indicated, go for higher potency, go for LM potency, the less the indication of the drug matching to the patient, go for lower, and while prescribing, depending upon the sphere fraction, they give mother tincture. And as Professor Bhattacharya told, when you base a prescription depending upon the miasmatic background and totality, there also you have to give in my study I have seen that when there is a the indicated drug fails, suppose there is a case of say spondylosis, there is indications of first motion aggravates and subsequent motion reliefs, aggression by cold, all symptoms of Rostock is there, but Rostock given no improvement. So in that case, I used to give a nozode or a bowel nozode, like psychotic or likewise. And in those cases, to make the blockage clear, I give usually 1 potency for a miasmatic blockage or for the family history, past history, any disease, and the miasm arising out, miasm to be considered, considering that disease, I give higher potency. See, this I have included in my study and also found to be effective. And in case of cervical spondylosis, I can conclude that because it is a prolonged treatment, because the persons, what Dr. Professor Bhattacharya told that psychosomatic is correct, but one IT person cannot avoid his long working because his company has got target. So in those cases, go on repeating LM potency higher and higher and higher, and it will take care of the even if the patient is exposed to that occupation, it can take care of the patient. This is my prescription. Thank you.
May I?
Yes,
Yeah.
yes. Your
May I?
experience?
So the scope of the potency extends between mother tincture to LM. Master Hahnemann started with mother tinctures, the discovery of homeopathy, and he ended with LM potency, which he said is the most perfect method of potentization. But I will not stick on with any one potency. It depends. The choice of the potency depends upon the susceptibility of the patient and depending upon the pathology, like state of the disease, like whether it's a deeper pathology or the acute state. But the most comfortable potency, which I have verified from the days of NIH till date, is LM potencies. But there is always a scope for other potencies. Only thing is, Master Hahnemann, what he has said is, you will have to modify the potency. Every next dose should be a modified one. It need not be necessarily a higher potency. It can be a lower potency also. Like for me, I found pulsatilla 0 potencies were giving me little aggravations. So when I hit on pulsatilla 1, it really gives me a comfortable course. This is of course a prejudice, but I am repeatedly verifying that. So it depends, like how it depends upon your experience. It depends upon the case in front of the patient in front of you, the pathology of the patient in front of you. The most comfortable and the most harmful and the most perfect of all the potencies is LM potency. If you are right with the remedy, you can just go through till you really get it cured, unless the indication for the remedy changes. So this is my opinion, sir. And I would like to hear a few words from Kalyani, sir, who is my favorite teacher in my college days. A few words from you, sir. And
Thank you.
Nanda, sir. Yes, sir.
What is my experience? That as we are completely dependent on individualization in case tracking and conclusion, individualization, selection of potency is completely in the similar way. It is individualistic approach. Never two cases will appeal for the same potency, same type of repetition. This is my experience that every case is variable. To whom which potency is most selected, it has been given in our literature. That should be carefully followed. In brief, that means what I want to tell you, what we got from our literature: higher the totality, higher the potency. Lower the totality, lower the potency. We have learned that higher the severity, fatality, accident, very finer changes which can cause gross damage. Say, for example, in case of spondylitis, where there is a complete slip disc, patient is becoming unconscious. There is deficiency in circulation, persistent vertigo, slightest postural vertigo, and MRI CT scan found that the cervical, your spine, has been compressed by slip disc. There we cannot think of any higher potencies other than lowest until patient gets some improvement. So in this manner, say for example, another patient who is maintenance factor cannot be avoided. He is a computer worker. He have to work. He cannot leave up his job. There, if he got his case with a little bit of higher symptomatology, their needs of repetition comes because patient cannot comply with the demands of its restrictions. Moreover, where there is a chance of risk but that cannot damage a life, there we can think of LM potencies. That means basic point will be higher or serious the pathology, finest the pathology for serious organs. We should not think never of higher potencies. We will think for lower potencies until we are confirmed about the improvement, then we'll think for the next potency. In our spondylitis research work, all the potencies were tried with the manner given in our literature. While we are getting higher potencies, we tried with very high potencies. Say for example, 10M, first potency was selected as 10M because patient totality is severe, patient is quite healthy, there are no other complications, then highest potency can be simply thought of. And we got very quick improvement because that matched with our literature, had the potency, had the totality. But where we find that a patient has been carried in IPD hospital, we have experience for admission, immediate admission, because persistent vertigo, becoming unconscious, and tremendous pain in neck, which is not getting relief by normal palliative analgesic drugs. There we had to start with 6 potency of the same medicine. So the potency selection is not at all difficult. We'll simply take the case, we will individualize, we think which potency is suitable according to his pathology, symptom totality, seriousness, vigorosity of his complaints, his lifestyle, how much time and management will be able to be afforded by the patient. That will guide us for the potency. But my experience and suggestion, and it is, I think you will agree with me, when you are confused which potency should be selected, then try with the higher and the higher among the lowers and lower among the highest 30 potency. Observe it. Your second prescription will tell you which potency is most suitable, whether the same potency to be repeated, where higher potency is needed, patient will be able to receive the higher potencies, or any other management should be given along with the selected potency. So potency selection is, again I am telling, completely dependent on the case to case. Once we select our drug, then we must concentrate what potency will be most suitable for the patient, covering all pathological, your mental, physical symptoms. That will give us expected improvement, time and speed. So thank you very much for asking this thing. And all of us will experience if we go on simply practicing the things given in our literature. I have never seen a single thing which is to be brought new for selection of potency. Okay, thank you.
So I think we should conclude. Before conclusion, I am telling you my experience of the potency. I am telling Dr. Kollari told you the potency 30. It is the quoting from Dr. B.N. Chakraborty. He usually used to say that the lowest of the higher potency and the highest of the lower potency is 30. You can start with it. So potency, from my point of view, I am telling you, this is, if you please try to keep it in your mind, on what type of symptoms you are selecting the medicine for your patient, it must be considered. Because if you are selecting a medicine on the point of Dr. Clark, Dr. That is who used to prescribe lower potencies, Hekla Labha. If you have selected on these pathological conditions, they used to prescribe this in 2x, 3x, 6x potency. So you can try with it. But when you are selecting a medicine for the patient with its totality, and after repertorization, you are sure that this medicine is selected for the patient, it is correct. Definitely, either you will have to go to the higher potency, or you will have to give 50 millisieverts pen, where you can repeat it. So this is the usual procedure I am telling I follow. I am sorry I could not mention one medicine. Very often, Dr. Kollari was telling the vertigo. Vertigo is a very, very important symptom of cervical spondylitis. And particularly, the patient is complaining that even in lying condition, I am feeling the vertigo. So you can try a single dose of conium maculatum 30. You will get instant relief. If not cure, afterwards you may have to select a medicine for totality of symptoms and cure. But for the palliation, a single dose of conium maculatum 30 will give the relief. So that is another very important medicine. None of us we mentioned this medicine for cervical spondylitis. So I remembered it from the words of Dr. Kollari. Now regarding potency, I am telling you, when we are selecting the anti-miasmatically medicine like Thuja, Creosote, Megaria, I am telling my experience, I have given 200 potency, a single dose. After observing, even after 10, 15 days, I have repeated, but 200 potency single dose is very important in such prescriptions. Usually, when you are to relieve a severe agonizing pain, when there is no pathological changes to kill the patient, there you can prescribe high potency. Sanguinaria can 10M I have prescribed for cervical spondylitis when I am sure that there is no pathological symptom and this extremely painful condition of the patient, a single dose of sanguinaria can 10M has relieved the patient. So potency, definitely there are some controversy, but one thing it is clear that the selection of medicine, how you have selected the medicine, and the patient, what is the inner condition of the patient, and the intelligence of the patient. Same medicine you are prescribing to a very intelligent person, and the same medicine you are prescribing to a very dull merited person. So the potency will differ. Where in intelligent persons it will be high potency, and in dull persons it will be low potency. There is contribution. There are some problem in selection of the medicine potency, but still, if you rationally think for it, definitely you will get some clue to prescribe a medicine in suitable potency for your patient. Thank you.
Oh, Sir, then you can conclude now. Bidyut, conclude.
Yes, we should conclude it. Dr. Bidyut, please conclude.
I think there is some problem with Bidyut. So with thanks to everybody, Sir, Dr. Bhattacharya.
Sorry to intervene. Sorry to intervene, sir. What Dr. Bidyut Mukherjee was trying to say that there is one more question, specifically asked to Dhanalakshmi ma'am. So due to internet connection, he was unable to say it. So that's why.
So please,
Dhanalakshmi ma'am, please.
Yes. Can I take that question? Yes. Why did I stop sepia 02 after 02? If you carefully observe the case, the patient is already in the process of in the path of the cure. She has already started having the discharge. She had I have mentioned you that she had diarrhea, which was really giving her relief, and then all the pains and the swelling were all coming down. She was having good sleep. The bowel movement, overall, she was improving. She was in the path of the cure. That is when she did not have a dysmenorrhea, she checked for the, when she did not get a menses, she checked for the UPT and it turned out to be accidentally positive. She did not expect that. So with the pregnancy, as she is already in the path of the cure, I already decided that I should stop continuing sepia. But as the pregnancy was confirmed, I go with Master Hahnemann's guidelines again. In chronic diseases, there is a mention of sulfur 200 sulfur as an antipsoric to be given for the betterment of health of both the baby and the mother, which will clear the miasmatic dyscrasia or miasmatic indisposition passed on to the next generation as well as the mother. This is what I hope. Let me see after the delivery how she's doing. So that is the reason I stopped. I did not want to unnecessarily continue the medicine which has already given its beneficial effect upon her. Thank you, sir.
Thank you so much, everyone, for joining with us.
Thank you, sir. Thank you, sir.
And since
today's seminar is really beautiful because it has taken maximum time, 3 hours and 12 minutes.
Yes, sir. It went very excellent. It was.
Especially, we are inspired by getting 2 directors and 1 principal. It is really good luck to us. Thank you, Dhanalakshmi. Carry on. Go on keeping records for the sake of homeopathy in us. That is the only way to develop.
It's a blessing to hear from you, sir. Thank you so much.
Surely, always.
Thank you, sir.
Thank you, Nanda, sir. Thank you, Dhanalakshmi. Good night. Good night.
Good night.
And one more thing to add to all viewers, please, those questions which are missed can ask on the comment section while on live replay. I hope Nanda sir and Dhanalakshmi ma'am can answer those questions after the session ends.
Sure.
On the comment section.
Sure.
Okay. So there is only one question. I hope anything else, any more question who are watching this on a replay basis can ask their question on comment section. I am confident to say that sir and ma'am will be able to answer your question on time. So with this, thank you all for joining with us, and a very good night to everyone who are watching this, and good night to everyone who have joined with us for this webinar.
Thank you, Arko, for this great help.
Thank you, sir.
Thank you.
And Arko deserves a round of applause.
Applause.
Sure, definitely.
Thank you, sir, very much. Appreciate it. Okay.